Please be seated. Good morning, Dr. Rockloff. Good afternoon, I think it is, Dr. Philander. Just before we start, I'll just go quickly through how we envisage today working. It's a concurrent evidence session of the experts in this area of responsible service of gaming and harm minimisation. What we'll do is we'll swear or have the witnesses take an oath or affirm. Then their respective counsel can lead them into the adoption of the reports, the respective reports, and any issues of clarification or amendment that need to be made. Then we will have first Professor Rockloff and then Dr. Philander give a summary overview of their current opinions and any matters of a disagreement between the experts that they see. And then their counsel can elicit further information from them. There will then be cross-examination. At the conclusion of the cross-examination, then the respective witnesses can ask one another questions and there can be an exchange between them on matters that they think are pertinent. The commissioners, of course, will ask questions at any time during the process, and then there will be re-examination, and during the process of re-examination, the witnesses will be afforded an opportunity to say anything that they wish to, whether opinions might have changed because of the exchanges during the day or where they think clarification is needed. Then, bearing in mind the tyranny of time zones, Dr. Philander, if he wishes, may leave us, and then there will be a broader, more general cross-examination of Professor Rockloff, followed by a final set of re-examinations. Now, I think that's the process. So if we then, if I ask Professor Rockloff, do you wish to affirm or take an oath?
Affirm, please.
If you would then just repeat the words after me. I, Matthew Rockloff.
I, Matthew Rockloff.
Sincerely declare and affirm.
Sincerely declare and affirm.
That the evidence that I give to this commission.
That the evidence that I give to this commission.
Shall be the truth, the whole truth, and nothing but the truth.
Shall be the truth, the whole truth, and nothing but the truth.
Thank you. Dr. Philander, do you wish to affirm or take an oath?
Yes, please.
If you too would repeat the words after me. I, Cahill Philander.
I, Khalil Philander.
Sincerely declare and affirm.
Sincerely declare and affirm.
That the evidence that I give to this commission.
That the evidence that I give to this commission.
Shall be the truth, the whole truth, and nothing but the truth.
Shall be the truth, the whole truth, and nothing but the truth.
Thank you, Dr. Philander. Mr. Lee.
Thank you, Commissioner. Now, Professor Rockloff, you have provided to this Commission an expert report dealing with gambling-related harms and harm minimisation. Is that correct?
Correct.
And that report was provided in answer to a request by the solicitors assisting the Commission?
Correct.
I'll first ask you to identify that request. If we can please call up PCRC.002200010001. And looking there first at the front page of that report. Once you've had a chance to look at that, I'll now show you some additional pages from that request. If we can go to page 6, please. Which there shows background information and assumptions. I won't take you through each of those, but we can jump to page 14 now, please.
Okay.
Which sets out questions on this page. They go over the next 2 pages. Do you recognise this document as the brief that you were provided with as part of your engagement?
Yes.
If we can please now go to page 17. There's an annexure here of documents. With the documents in this list of annexures provided to you by the solicitors assisting the Commission?
Yes, they were.
Commissioners, I tender that request for a report.
That request is admitted into evidence, and it bears the identifying number PCRC.0022.001.0017.
Commissioner, I believe the number is PCRC.0022.001.001.
Thank you. Make that amendment.
Thank you. Moving to the next document now, which is a report itself at PCRC 0100.001.001. Professor Rockcliffe, does this appear to be page 1 of the report that you provided to the Commission?
Yes, it does.
And if we can please go to page 4. Is that your signature on the page?
Yes, it is.
If we can now please step through pages 5, 6 and 7, which show the index to the report. And if we can now step to page 7 as well, please. Do you recognise that as being the index for the report that you provided?
I do.
And lastly, if we could please go to page 40 and 41 and have those side by side. These are the final substantive pages of the report. Do you recognise these pages as well as being a part of your report?
I do.
Now, before I tender the report, I'm just going to ask some brief questions about your qualifications. If we can please go to page 60 of this document. In the centre of the page there is a reference to your education history, shows your PhD in psychology at the top, and then 2 degrees relating to economics. The one that's entitled MS Economics, is that a master's degree?
It is. Masters of Science.
Master of what, sorry?
It's termed Master of Science in economics.
Thank you. Can you explain to the Commissioners what your degree of study was in relation to that master's degree in economics?
Well, it was primarily involved in microeconomics, and it was on a plan to eventually get a PhD in economics. And during that time, I decided to stop with a master's and then move instead, based on my interest, into a PhD in psychology.
All right, thank you. That can be taken down. Have you had a chance to review your finalised report prior to giving evidence today?
I have.
And having done so, are there any matters in the report in respect of which you'd like to make additions, caveats or corrections?
Yes, there are 2 issues where I'd like to make corrections.
And can you take the Commissioners to those, please?
Yeah, so on line of the report 696, I'd like to strike the sentence that says even the RGAP was critical of this approach and recommended more proactive measures to raise awareness, including the use of pop-up messages on EGMs.
Because that's the sentence that begins at the end of line 696, then runs through 697 and halfway through 698. Is that correct?
Correct. And the second alteration that I'd like to make is on line 844, where I'd like to change part of that sentence where it says already being harmed and who asks for help, and I'd like to change that to showing showing identifiable signs of problem gambling.
So let's start with the words that you're striking first. Which words are you striking?
So striking the words already being harmed and who asks for help.
Thank you.
And changing those to showing identifiable signs of problem gambling.
Thank you. Now that those changes have been made, to the extent that the statement contains statement of fact, do you believe those statements to be true?
I do.
And to the extent that the report contains opinions, do you honestly and reasonably hold those opinions?
I do.
Commissioners, I tender that report.
Thank you. The report entitled Gambling Harm and Harm Minimisation in Western Australia, dated October 2021, of Matthew Rockloff, and bearing the identifier number PCRC.0100.0001.0001, with the two corrections which have been described, will be admitted into evidence as an exhibit.
Thank you, Commissioner. Professor Rockloff, I'm just going to ask you some questions in clarification now. If I can please have page 21 and 22 up side by side. And you can see starting at 469, there's a statement: discouraging visits beyond 4 days a month is consistent with the recommended low-risk gambling limit. Can you just explain to the Commission what you mean by the concept of a low-risk gambling limit?
Yes. So I have notes that I can refer to here on that, if you'll allow me. Yeah, so that's referring to in the Anatomicist report 2014. They did an analysis where they showed that the majority of non-problem and low-risk gamblers gambled for 3 or more hours only rarely or never, and whereas a majority of the problem gamblers gambled for 3 hours or either occasionally, frequently, or always. So problem gamblers were much more likely to be represented in a group of people who are gambling over 3 hours.
So is that the point of the limit, that if you go beyond the limit, there's a significant increase in people who are gambling beyond that limit who are likely to be problem gamblers? Is that the point?
Correct, yeah. And so that doesn't mean that everybody who gambles beyond 3 hours is a problem gambler. It just means that there is a greater representation of problem gamblers in people who gamble beyond 3 hours.
Thank you. If we can now please go to page 29. And if you look at line 771, there's a note there that an intervention is not triggered until the customer's been on site for 18 hours. Do you see that?
Yes.
And the next sentence says that 3 hours of gambling without a break is a good predictor of gambling harm. After that point, the report goes on to say that if the casino's practice in this area is indicative, it appears that customers already experiencing harm from their gambling are routinely ignored. What do you mean by the reference to customers already experiencing harm?
So customers who are gambling more than 3 hours, a lot of them are, there's a higher representation of people who are problem gamblers, and those problem gamblers are already experiencing harm because there's no intervention at an earlier time, less than 18 hours. Then those gamblers are gambling without any intervention.
And the final question I had at this stage is at page 32 of your report. So starting at line 860 towards the end of the line and going down to 862, I beg your pardon, page 31 for the transcript. There's a comment there that there's an attempt to address harm that's already occurred and only amongst customers who explicitly ask for help. What are you referring to when you're talking here about an informed choice model and it only helping those customers who explicitly ask for help?
So the informed choice model predates the Reno model, although Reno model is an example of an informed choice model. And the central premise of informed choice is that as long as you don't have a mental health condition, gambling problems, then you as long, and if you're fully informed about how the games work, then you're making an informed choice to play the games, and by definition, then you are freely choosing to engage in a leisure activity that causes that creates consumer surplus for you, that makes you better off, and so we know that there are a set of people who regret their gambling decisions, even people who don't have mental health issues, and so some gamblers will already be harmed, even if they don't have that mental health condition.
And so what I'm just trying to zoom in on here for the moment is the final words of that sentence where it says customers who explicitly ask for help. What is bound up in the concept of asking for help? Does it require the words, please help me, or how does it work?
Yeah, and in practice, it often doesn't. So obviously, some people explicitly ask for help, but that is stigmatizing and embarrassing for a lot of people, as you might imagine. And so interventions are often of the quality, particularly in pubs and clubs, which we have some knowledge of because of some research that a colleague of mine has done in New South Wales, where people are approached, typically showing signs of identifiable signs of gambling problems. Maybe they're crying at the machine, or they're talking, complaining about their losses. And then the responsible gambling person in the casino will ask that person to have a cup of coffee, so that they and take a break, and potentially discuss what's going on with their upset. Unless that person chooses to engage with the person who's saying, "Hey, let's have a cup of coffee and talk about this," then they're not helped in any way. So they have to explicitly choose to engage with somebody who's offering to talk to them about that problem. And in that sense, they have to ask for help by engaging. And some don't. Some will say, "Buzz off, leave me alone," either due to embarrassment or because they're not in that stage of readiness to change.
Thank you, Professor Rockhold.
Thank you. Mr. Damananda.
Thank you, Commissioners. Dr. Philander, you've prepared a report in response to a request from the solicitors acting for the group.
That's right.
And that report, if I could bring it up, is CRW.998.002.1212.
That's correct.
That's the front page of your report.
Correct.
And the instructions that were given to you is at page 1233 of that report.
That's correct.
And your CV commences at 1236. 1237, I beg your pardon.
Correct.
And you've addressed the matters to which you were directed in the letter of instruction from Crown Solicitors.
That's right.
And to the extent that your report has matters of fact, you honestly believe those facts to be true.
I do.
And to the extent that your expert report has matters of opinion, you honestly hold those opinions.
I do.
Are there any matters of clarification that you wish to raise with the Commissioners?
No.
Thank you. I tender that expert report, Commissioners.
Thank you. The report entitled Independent Expert Evidence for the Perth Casino Royal Commission, November 2021, of Khalil Philander, and bearing the identifier number CRW.998.002.1212, is admitted into evidence and is as an exhibit.
Thank you.
Mr. Dharmananda, has Dr. Philander seen the document that was prepared a couple of days ago that set out the 5 questions? Has Dr. Philander seen that?
Set out the protocol, Commissioners?
When we were developing the protocol,
Yes.
there were 5 issues identified.
Yes.
I wonder if Dr. Philander has seen that.
No, he hasn't, Commissioners. We weren't certain of the process.
Thank you. All right. Thank you, Mr. Dharmananda. Then now it's over to you, Professor Rockloff and Dr. Philander, but we'll start with Professor Rockloff, and if you could give us a summary overview of your current opinions and explain what you consider to be the principal issues of agreement and disagreement between you and Dr. Philander.
Sure. I just want to point out that I've made some notes, and with your permission, I'll refer to those notes in talking about these issues. Just for a reminder, I'm not reading from the notes, or hopefully I won't be, but that'll help me make sure that I don't leave anything out.
Thank you. That's quite appropriate.
Okay, so I think the first issue for me, the large issue, is on gambling-related harm and how that's viewed. So I see a gambling-related harm as distinct and different from gambling problems. Gambling problems are symptoms of a mental health condition that is known as disordered gambling if it's diagnosed by a psychiatrist or a psychologist. But more generally, we know it if it's non-diagnosed as problem gambling. So people with gambling problems will have those indicators of mental health conditions. Some of those will be harms, but some of them will be other things, like returning another day to try and win back money from gambling. So they're just indicators that you may have a mental health condition. So due to there's a large number of bettors who cannot be classified as problem gamblers because they don't have enough gambling problems to make that judgment, there's a large amount of aggregate harm, however, that's suffered by the non-problem gambler group, people who have lesser problems than might be diagnosed as having a mental health condition, just because there's so many of them. So problem gambling is relatively rare. About 1% in the adult population. It varies from time to time. It's gone up in the last 10 years. But nevertheless, there's a much larger group of gamblers who first suffer from no problems, and then there's still a somewhat smaller but larger than problem gambler group that suffers from some gambling harms, but is not classifiable as a problem gambler. So in our conception, or in my conception, the seriousness of gambling harms should be judged based on its impact on health and well-being of gamblers. That is, we can actually find out by asking people whether their health and well-being has been affected by the harms that they experience from gambling, and shouldn't be based on some arbitrary judgment about what is a serious harm. And so we've seen arguments that people have made in the literature about saying, oh, these are opportunity costs, these are not really serious. Well, the argument that we have based on data is that if something you say that you're harmed by gambling, and if that gambling harm decreases your well-being, then in fact, that's how we should judge whether you're harmed or not based on some arbitrary judgment of a professional who says this is not a serious harm. So gambling related harm research by Brown et al., I am the et al., the other people who contributed to that research, to my understanding is highly influential in the field. However, it's not well considered amongst a subset of researchers, and that subset of researchers often are either coincidentally or for other reasons, people who accept gambling money for doing their own research. the burden of diseases methods that underpin gambling harms research are well accepted within public health broadly, and in fact, they're used extensively by the World Health Organization, and they have been for decades. So we're not running off the rails with this methodology. It is actually something that is used very extensively, including in alcohol abuse field, but in a very large number of other disease conditions, including mental health conditions. We are some of the first people, if not the first people, who have applied that methodology to gambling. And so in that sense, it's new. So this is where it gets a little bit sensitive in the sense that I don't want to characterize what Philander thinks, although I'm trying to point out points of difference. So please forgive me, Khalil, if I get it wrong, but you can tell me when I get it wrong later on. It's not to create problems, but to create better understanding. So my understanding in the difference that he may have in his opinion is that he may believe that people can't be seriously harmed by gambling unless they have a gambling problem or are on a path towards developing a gambling problem. That is, unless they are on the path to developing a mental health condition. They can't truly be harmed by gambling. A corollary is that most or all harms occur to problem gamblers, not to people who are less than problem gamblers. The seriousness of gambling harm should be based on something other than our public health impact measures that we use, those World Health Organization public health measures. And I don't know what those he believes those are, but often people in the literature have talked about essentially professional judgment, that people who are gambling researchers should be able to judge whether a harm is serious enough to be counted as something that harms the gambler. Again, our opinion is that we should actually ask the gambler as to whether that's affecting their well-being. So many harms from gambling, he may believe, are simply opportunity costs. We find that argument a lot. Opportunities forgone by spending money on gambling instead of something else. And so those things that we count as harms that decrease your well-being are in fact just people rationally making a decision to spend their money on gambling when they could have spent it on something else. And gambling research, related research, is not generally accepted by prominent gambling researchers. So I think that was part of the submission. I don't think that's true. It's true in some circumstances that some gambling researchers don't accept our methodology, but I think it's becoming quite popular and quite influential amongst a set of gambling researchers. So the second area of difference, I think this is somewhat minor, is the gambling-related benefits. So I've done some research in Tasmania that used the same quality of health metrics to see whether people, to try and make a balance between whether people are harmed by gambling and all the people in Tasmania, based on population research, that are benefited by gambling, and try and make a balance between those two to see if there's a net harm or net benefit to Tasmanians. And so social impact. So I think this is it's a new methodology. I wouldn't say that it is the be all and end all and the final word on gambling benefits and harms, even in Tasmania. However, I think it's a valuable contribution. I also believe, though, that social impact assessments that are often done can complement those quality of life approaches that I've used in understanding what the net benefits are. And Dr. Philander mentioned those social impact assessment sort of techniques. I agree that those are good. One of the problems with them, however, is that they tend not to provide an overall summary as to whether, for example, new gambling opportunities are good or bad. It just provides a menu of a whole bunch of different things that you can consider, some good, some bad, and people use motivated reasoning to come up with whatever conclusion that they want from those social impact assessments. So that's the sort of bad point of social impact assessments, which is not to say that they're bad. I think they're actually quite good and something that should be considered. And again, I think I should mention about that research on harms and benefits. It's really in its infancy, so further refinements and methods and cross-validation of those results are really necessary to understand them. So in contrast, what I would, again, suppose that Dr. Philander would say that is he doesn't believe in net benefits can be measured using those quality of life metrics. He's expressed some doubt about that in his submission. And he believes that social impact assessments are the way to measure costs and benefits, perhaps to the exclusion of any other methods. So number three, regulatory and policy approaches are a point of potential difference. So I mentioned informed choice is the dominant paradigm for industry approaches to gambling problems and addressing gambling-related harm. In particular, the Reno model, although not being the first instance of informed choice, has provided cover for industry to implement very minimal interventions, things like self-exclusion if people ask for it, without some harder measures that might actually produce greater benefits. That's not to say self-exclusion isn't good. It's just that it provides a backdrop in which one can say that I've done, without imposing on people's freedom of choice, I've done all that I can do as a gambling provider to help people with the problem, and therefore this is the limit to which I can actually affect change. So the Reno model does include duty of care for operators and government, consistent but consistent with gamblers maintaining their freedom of choice. So that excludes some, potentially very effective measures like mandatory spending limits that might impose on people's freedom, but also might help a lot of people with gambling problems or people with gambling harm. The duty of care in general, although I'm certainly not an expert on the Reno model, I think is poorly specified. It, at least in its initial publication, certainly suggests that harm can only occur to people who are problem gamblers, not to people who are non-problem gamblers. And at the moment, there's little evidence that informed choice is really working to reduce gambling problems. So as I said, in the last 10 years in Australia, we've seen an increase in the number of people with gambling problems. And so there's, there's this dominant model of informed choice that is how gambling problems are addressed in Australia. Gambling problems are going up at the same time that that approach is being used. And so there's a question as to whether it's truly effective or not. So in contrast, I think Dr. Philander might say that the Reno model has been helpful in reducing gambling problems. Overall, the model has not provided cover for the industry in any way, and that the duty of care by operators and government is well specified within the model. And that the Reno model is a position paper. It's not testable with respect to whether it reduces gambling problems or not. Just as a position paper, you can't make a judgment as to whether it's good or not, just based on the movement of gambling problems. Number four, we have 5 different things, so if you're wondering where we're at. Number 4, potential measures to reduce gambling harm. What's an effective measure to reduce, what are some effective measures to reduce gambling harms? I think based on first principle reasoning, mandatory pre-commitment is likely to reduce gambling harms. That is, allowing people to choose while they're in a cool state how much they want to, how much maximum losses that they want to incur. And then when in the hot state of actually gambling, they are compelled to hold to those commitments. So if they exceed the amount of losses that they said that they'd like to limit themselves to, that there's cut off from gambling at that point. Mandatory commitment has been largely untried. And where it has been tried, it's been consistently undermined by industry. So where people have proposed mandatory pre-commitment, wherever it's done, if it's in Nova Scotia or if it's in Victoria, industry is balked. and it's been turned into voluntary pre-commitment, which means that at least most people can choose not to engage in voluntary in the pre-commitment at all. And in that case, it just becomes not pre-commitment at all, in my view, but in fact just a budgeting tool for a few people. And generally, people don't use it when it's just a budgetary tool that they don't need to use. So in contrast, I would imagine that Dr. Philander would say that mandatory pre-commitment is unproven and should not be implemented yet, and that none of the structural changes explored in the submission that we provided have strong evidence, and none should be implemented due to possible unintended consequences. In many cases, I was not clear on what those unintended consequences were, but he did mention unintended consequences. Okay, so the last bit, I hope I'm sticking to time, but we'll see, is industry funding. And so there's an issue of industry funding here that I believe in, which is that gambling researchers should not accept voluntary funding from the industry, since this poses conflicts of interest when conducting the research. Now, this is not to say that gambling money doesn't fund research. In fact, most of the research, if not all the research that I do, is financed by gambling money. But the key point here is that it's not voluntary. The most, at least to my knowledge, and I can be corrected on this, but to my knowledge, it's very complicated and murky, but to my knowledge, the gambling money that I take from state institutions are provided on a non-voluntary basis. So the industry money is corralled, and the gambling industry has no say about whether they're going to give money over to research interest, and certainly they have no say in how that gambling the research projects are conducted, or what research projects are conducted. Conflicts of interest cannot be resolved in any way by declaring those conflicts of interest. So a common refrain amongst people who accept gambling money is that they say, oh, well, I've declared all my conflicts of interest, so now it's fine. But I see that as no fix at all, that you can't just have conflicts of interest, declare them, and say, well, anybody can take this with a grain of salt because I've declared my conflicts of interest. It doesn't resolve them in any way. It just allows people to perhaps see those conflicts more clearly, but it certainly does not fix them. Gambling researchers who have now this is an admission important. Gambling researchers who have accepted industry funding have been made very important contributions, and some of those contributions have been funded by industry. So this is not to say, hey, everybody who accepts gambling money from industry is bad, or is dishonest, or makes a poor research in that regard. And in fact, most of the people, without naming names, most of the people who we have a difference of agreement with are people that we work with on a regular basis. So we do joint research with them, not industry funding, of course, but we do joint research with them, and we're quite friendly with. So this is not to suggest that in any way the gambling researchers are dishonest. And in fact, I have no personal knowledge of any gambling researcher who I've considered dishonest in any way. So I want to make that point really clear. Industry funding skews gambling research, in my view, towards funded projects that suggest gambling problems are limited to a small set of people with a mental health condition, to the exclusion of public health risks. So there's no public health type research, to my knowledge, that is funded by gambling industry money. It's all about funding research which suggests very strongly that gambling problems and gambling harm is suffered by a small set of poor people who suffer from mental health condition and need all our help. So the Reno model reflects an informed choice approach, and that approach, I don't think this is necessarily the intention of the approach. I think, again, I think the intentions are good in the Reno model in terms of the people who have proposed it, but it has been very useful in limiting the types of interventions that are used by and considered by industry, because it allows them to say, hey, we can impose on people's freedom of choice. That's the fundamental underlying principle of the model. And therefore, it creates a very limited set of interventions that people can actually propose. And so it's been very useful to industry by codifying that in an academic and broadly accepted format. I also would say that gamblers sometimes regret their decisions about their gambling, even when they're fully informed. So that regret that people have, if people freely choose to gamble and never have regrets, well then I guess one could say they're never harmed because they've made that choice and they've had the consequences. But if they suffer from regret, I would argue that even if they're fully informed, that they can be harmed by gambling. So lastly, in contrast, I would imagine that Philander would believe that gambling researchers can accept industry money without being influenced by the topics they choose or the results they obtain. That declaring conflicts of interest at least goes some way towards resolving those conflicts by alerting the reader to those conflicts of interest. And that gamblers are best placed to make their own decisions on how much they gamble, as long as they don't have gambling problems. And that's the end of my statement. Thank you.
Thank you very much, Professor Rockcliffe. Dr. Philander?
Thank you very much, and allow me to make the same qualifications that Dr. Rockcliffe made about these disagreements just being in a matter of trying to provide as much evidence as we can to the Commission. So I think the overall theme, to the extent to which we might have disagreements, in large part boils down to what I think is appropriate in terms of ideas or discussions that occur in an academic setting versus those that I think are appropriate to a policy setting. And just by way of my background, I'm not entirely a career academic. I spent time in an academic institution, but then I also worked in a nonprofit organization advocating on the behalf of problem gamblers and doing research in that area. And then I also spent time working for a government-owned operator that both operated aspects of the gambling industry, but also set policies for private operators as well before coming back into academia. So that just sort of reflects my general experience and views on a lot of these issues. As far as more specific topics, I think there's, I'd say, roughly 3 core areas that I think deserve a little bit more detail. So the first is the degree to which I think some of these items around harms can be measured and netted out. The second is the degree to which I think we can be confident that some of these responsible gambling interventions that were discussed can actually be viewed as something that would be helpful. And then the third is really, I think there's differences in what we think would be the most compelling model in order to be adopted from a social welfare standpoint. So on the issue of the measurement of harm and Dr. Rockcliffe's work, I think is a fantastic academic study. And but my concern is that a lot of the methodologies that were used, I'm relatively skeptical about the extent that they're measuring what we would hope that they measure in a public policy setting. And so when we're thinking about the idea of measuring harms and then measuring net harms, Dr. Rockcliffe, again, I just talked about the idea of, well, let's ask gamblers, whether or not they're receiving benefits or they're receiving harms, and use that as a basis of our measurement. And what I find challenging about this approach is that when you get into the actual details of one, trying to contact a fair sample, a fair representation of what the population's like, and then trying to get into the details of how do you actually ask these questions to truly elucidate the actual numbers that we want, I'm not convinced at all that we can actually get to the idea of what we're measuring as harms. I think a lot of the items that Dr. Rockcliffe outlined as, this is something that could potentially be a harm to an individual are accurate. There's some disagreements that I have, and those are really around opportunity costs. But in terms of the measurement of harms, with these types of studies, what you have to do is you have to ask people a question like, do you feel that gambling is good or bad in your life? A question like that. And to the extent that they might say it's bad, you ask them a follow-up question like, do you think this makes your life 2% worse, 5% worse, 10% worse? And then the same thing, if they say it's something good. And the concern that I have is that when somebody's responding to that question, it's just something that's entirely arbitrary and capricious around, what those numbers truly mean. And in the case of gamblers specifically, particularly if we're talking about somebody who has cognitive distortions, they don't think properly around gambling, to presume that they can accurately take these quantitative figures and give back a realistic representation of what they're truly feeling from a health standpoint, or make some sort of trade-off around, I'll have, say, 8 years with healthy gambling or 10 years without healthy gambling. These are the types of methods that you would have to use in order to produce these types of numbers. I think these are interesting exercises from an academic standpoint. I think they're interesting in terms of benchmarking, perhaps across time or perhaps across different activities or jurisdictions. But to the extent that we're going to make any decisions that gambling is something that's net good or net bad on the basis of these types of methods, I don't think that makes sense from a public policy standpoint. And so when we then take these methods and we start to make downstream inferences about what they're truly saying to us, like, are there more harms coming from people who have gambling problems? Or are there more harms from, like a wider sample of gamblers who might have a very low risk profile, but these small net harms add up? Well, at that point, I become quite skeptical that, the idea that most harms don't actually come from people with gambling problems. I just don't believe that really makes sense. And so we can talk about like wider context in terms of, does it even make sense at all to think that there's net harms to people without gambling problems? I don't think that makes sense because, if we assume that people with gambling problems aren't making rational decisions around their gambling, and that's basically the clinical criteria of having a gambling problem. Well, then the flip side of that coin is if you don't have a gambling problem, on some level, you're making a rational decision. And we might say, okay, well, some people still do overspend or they might regret their decision. But in the context of other recreational activities, that might be the case as well. So, you can think of the analogy of, going to a football game, spend a few $100s to go to this game, and you think you're going to have a good time if your team wins, but if your team loses, then you won't have enjoyed yourself necessarily. And so you still might have purchase regret at the end of that event because there's some sort of degree of randomness in that consumption experience, much as there is the same random outcome with a gambling experience. But to make inferences that was necessarily a bad decision or that it was an irrational decision or something that's worth discounting from the value that, gambling might bring as a recreational activity, that is something that doesn't make sense to me. The next item that I think is worth discussing is around what are the causes of harm. And, I think I've identified that I believe most of the harms, to the extent that they're actually relevant to public policy decision-making, are those harms that occur to people with gambling problems. And then when we think about what are the causes of these harms, well, it's not a simple idea of what causes one thing in some sort of long chain. I mean, the leading model of the causes of gambling problems is a biopsychosocial model that basically says there's genetic predispositions, there's environmental factors, and then there's social factors, but there's also these mental factors that occur within individuals. And all of these things interact in order to create the condition where somebody might reach that higher level of risk. And, you know, part of the report that Dr. Rockcliffe wrote talked about the idea that some academics revel in complexity of these issues. And, you know, I don't think that's necessarily fair. I think these are really complex issues, and to try to, you know, reduce them to, you know, a single product or a single environmental circumstance or even a single solution might fix all these things. I think that's just not a fair representation of this, you know, this you know, system, this infrastructure that exists within humanity, that's existed for thousands and thousands of years, and which now exists in a modern iteration. And I think to discount the level of complexity and to think that you just, you know, change a couple levers and all of a sudden this problem might be solved, I don't think that's a reasonable way to approach it. And that's why I think the idea that is discussed in the renal model, one where it's not necessarily only about informed decision-making, it's about identifying who are all the stakeholders that are responsible for mitigating harms to the extent that they exist across this entire, you know, system of gambling. And then identifying for each of those stakeholders, what's the role that they can play in helping to solve this issue. I think that's a really nice model to embrace from a public policy standpoint. Now, I know Dr. Rockcliffe is critical of the idea of the informed decision-making approach to the gambler's role within this. And I'm paraphrasing there a little, to be fair. But when thinking about what's the right approach to managing the right amount of gambling consumption for individuals, I think it's helpful to think about how you might approach different decision makers' effectiveness in identifying the right amount of gambling for each person. So obviously, I think it's clear that an uninformed individual will not make good decisions for themselves. But I also think it's the case that people who are not that individual, particularly centralized entities that would have to make decisions in aggregate, can't make the right decision for every single person at every single moment in time. And, you know, I think about the people that I'm closest to, you know, I think about my family, like, I don't even know what they want for dinner tomorrow. And to think that, you know, I might, for each of those individuals, identify the right amount of gambling for them, or that at a wider scale as a regulator, as a policymaker, even as an operator, that you could make the right decision for every single person that walks in. I just don't think that's the right approach to address this issue in the most effective way. I think the right way to approach it is to make sure that we've done everything that we can, that from each stakeholder's perspective, that every individual is empowered to make as good a decision for themselves as they possibly could. Now, it doesn't mean that we're going to get it perfect, and it doesn't mean that every individual is going to always make a perfect decision for themselves all the time. But when we think about what's the alternative, that we have to create, you know, broad policies that affect every single individual, well, having a model that emphasizes informed decision-making for individuals while identifying the role of every stakeholder in that process, to me, is the most compelling model that we could use. And so you know, that's my general perspective on, you know, sort of what's the most compelling model. I think I was fairly clear in terms of specific interventions, whether that's pre-commitment, bet size caps, entry fees, maximum spends. I think these are all interesting ideas that might play a role in certain systems, but I would be very hesitant to suggest any regulatory body, any policymaker to broadly accept any of these. I think what we're at the point in gambling research and you know, in responsible gambling operational designs, where, you know, we have some good ideas, we have some bad ideas, but we don't really know which are which. And so I think embracing an approach to responsible gambling that aligns with that philosophy of empowering people to make better decisions for themselves, recognizing that we don't have the full toolkit that we'll have, say, 20 years in the future, even 10 years in the future, allowing some flexibility to test different ideas, test different interventions, but then adapt them quickly if we have to. I think that's the approach that makes sense to me. And so, when I think about what's the role that public health plays in all of this and public health models, I identified the health impact assessment model, which I think is the one that, best sort of fits into this idea. And that's, like a little bit different than the model that Rockcliffe articulated. It really is about not necessarily trying to net out, is gambling a good thing or is it a bad thing? But about figuring out, how does gambling improve health outcomes? How does gambling have a negative impact on health outcomes? And creating greater transparency for all stakeholders and engagement for all stakeholders in that process over time. And so that's, I think, captures my view. Hopefully, some of the areas where I disagree with Rockcliffe are a little bit obvious in that context. But I'll just pause there in the interest of time.
Thank you, Dr. Philander. Could you just expand for me? You when you were talking about the informed decision model, you talked about how the difference between an informed individual and an uninformed individual making the right decision, or not necessarily always making the right decision. Can you just expand on that for me from the point of view of the imposition of a model, as opposed to looking at it from the perspective of the individual? If freedom of choice is regarded as a human right, for example, you can look at it that way. But I'd just like you to, if you can, to say what you think that means for the imposition of a model.
Yeah, I mean, so if we want to constrain the way that we're thinking about this to the imposition of a model, I guess I would frame it this way. The role of the individual as well as other stakeholders in the gambling industry under an informed choice model reflects the idea of making sure that the gambler is aware of all of the risks that they're taking when they start to gamble. They're aware of the nature of the game that they're playing, and they know what steps to take should they have any symptoms or have any other issues. That is, they don't necessarily, a good example of this is, they don't have any false beliefs about the game that they're playing. They don't think that they can actually win on a slot machine over time. Now, this is different than, say, a fully libertarian model, where we might presume that each individual is allowed to just go in and not be bothered at all. So I think that's sort of the distinction that I would draw in my mind. And in the informed model, what we're looking at is, to what extent do stakeholders play a role in helping make sure that individuals who choose to gamble are aware of the risks and know where they can get help. And so, when I would think about this model, when I was running responsible gambling programs, I would think about the role of the gambling operator in the context of, we're focused on the player who's actually playing the game, who's using the product. And we want to make sure that they are aware of all the right beliefs and are engaging in the right behaviors that are consistent with responsible gambling. But that's not the full extent of what we would hope for the public health model to be. We'd also hope that, say the people in the Ministry of Education are focused on making sure that as people come through the education program, at some point, they learn about the risks of gambling, and before they even walk in our doors, they know that gambling can be a risky activity. Likewise, we hope that people in the Ministry of Health know that there's going to be people who have been gambling that develop harms, and that there's the right treatment resources available for people as they need them. And so, that's the difference, I think, between a focus on making sure there's informed decision making versus one that's completely libertarian, where we're just letting people do whatever they wish at all times.
Thank you. Thank you. Mr. Lee, is there anything you wish to take up with Professor Rockloff at this stage?
Yes, Commissioners, if I may. Professor Rockloff, obviously you've had the opportunity to hear now from Dr. Philander, and there are a few points that were raised in the course of that introductory session that I'd just like to invite you to comment on. One of the things that was spoken to by Dr. Philander was the question of the methodology by which harms are assessed, and he talked us through the sorts of questions that might be asked and the way that people are requested to give responses such as my life is 2% better, 5% better, or so on. Firstly, can you just indicate to the Commission whether you broadly agree with that characterisation, and if not, what you would add to give your view of that characterisation or correct characterisation?
Yeah, look, I think he mentioned one of the methods that we use to see whether people are disadvantaged in the sense of is your life better or worse. But the other method, the sort of triangulation that we also use, is purely associative. So there are measures of health and well-being that are well validated and that are used by the World Health Organization that basically just ask, how great is your life? In general, not relating to gambling at all, but just saying, do you feel safe in your community? And all sorts of questions around what actually even things like, can you comfortably walk a flight of stairs? So that's a health question. And when you combine these together, so there's something called the Australian Unity Wellbeing Index, for instance, that is just a measure of general health and well-being of an individual. And you can actually find an association between those measures as well and people's gambling harms. The more gambling harms that a person has, even a person who is not a problem gambler, clearly not a problem gambler, the more harms they have, there is a direct association between having those harms and having a poor quality of life on those more general measures. So it is true that sometimes we directly ask people with the time trade-off method, which is something that Dr. Philander talked about how their health and well-being is. But generally, and sometimes we ask them directly in relationship to their gambling, but sometimes not in relationship to their gambling. We use these associative measures as well. And all of them broadly show the same result, which is the more harms you have, the more likely that your well-being is going to suffer. And I think the true difference there is a binary assumption that a lot of people in gambling research have, and people outside of gambling research have. Binary is a lot easier to think about. People either have a gambling problem, boom, or they don't, and they're completely fine. There is just really no evidence for that at all. In fact, gambling problems themselves that we use to diagnose whether a person has problem gambling have this kind of distribution where a lot of people have one gambling problem, and a slightly smaller number have 2 gambling problems, and a slightly smaller number has 3, and it goes on until we hit the magical number of 8 gambling problems on the problem gambling severity index, and then suddenly they cross that threshold and they're called a problem gambler, and there's somebody who is suffering from a mental health condition. Now, if you look at the distribution of those harms that has this sort of exponential decay, it would be hard to understand why that number 8 is sort of a magical number where somebody is suddenly thought to have a mental health condition and the people outside are not. And that's not to cast doubt on the fact that I do believe that some people have, an addictive disorder that is called problem gambling. There is a point at which gambling problems are so severe that we might consider that person has a mental health condition. But that binary thinking of people having a mental health condition or people not having a mental health condition is just not consistent with the data. It's not consistent with even the old-fashioned data of using the PGSI, the Problem Gambling Severity Index, but it's certainly not consistent with both our associative measures of gambling harm, but also our elicitation methods that Dr. Flander was talking about as well. So all of those, regardless of opinion, are things that we've shown that harm is actually happening to people who are not necessarily problem gamblers.
Thank you, Professor Rockdorf. This may be a question which is not possible to answer, in which case you can just tell me that. But when you are considering the sorts of harms that are experienced by people who are not yet above that threshold, however it might be calculated with whichever scale you're using, so that they haven't crossed over into being a problem gambler,
Yeah.
in terms of assessing the way that those harms they are still experiencing decreases or impacts on their well-being, is it possible to give us an analogy so we understand the comparable severity of what's being experienced, or is that not something which can be done?
Yeah, so one example of that, that we've shown in our research is that, for instance, somebody who is suffering from, a gambling problem or problem gambling level of severity will have a quality of life decrement that is pretty close to a person who would have the same quality of life decrement from having alcohol abuse disorder, or what more generally would be called alcoholism. So being an alcoholic versus being a problem gambler, how miserable does it make your life on these quality of health life metrics? Well, about the same. Actually found problem gambling was just slightly less, but it's certainly within the range of error.
Okay, so that's in relation to the problem gambling. I'm just curious if it's possible to talk out something which is below that level. So not yet problem gambling, but harms experienced. Is it possible to then give a broad articulation as to the impact on well-being, or is it too varied for that to be a sensible question?
No, we do, and this is unfortunately a bit of a memory test for me, because we have estimated exactly that in our Victorian harms, our original Victorian harms paper. And so, the range is very low from, I think, a 10% decrement to health and well-being is, to the best of my recollection, for low-risk gamblers with a few problems, going up to, I think, maybe 30% or something like that for moderate risk. And then about I think it was the 0.46%. So the nice part about these metrics is that it's a decrease to the quality of your life in a way that's very easy for people to get an intuitive sense of what it means. That is, you can take it as a percentage decrease in your quality of life. And what happens when your percentage decrease reaches zero? Well, that means that you're so miserable that you might as well be dead, because your quality of life is so bad that you would you just as well rather not have the life, because you're not enjoying any benefits to life. So problem gambling subtracts almost half of your well-being, but again, the lesser amounts, I can't remember the exact numbers, but it's somewhere in the range of like 10% for low-risk gambling and 30% or something like that for moderate-risk gambling. But again, I'd have to take that on advisement because I can't remember the exact numbers.
All right, thanks. That's taken us through some of the methodology that underlies the research that Brown et al. And others have done. That obviously has led to a debate between yourself and Dr. Philander in the papers. And Dr. Philander has talked through in his paper some of the responses to Brown's work from Del Fabro and King. And I'm just wondering if you can tell the Commission, has there been any further dialogue or interaction between those camps? Have there been any further studies that make use of Brown's methodology? And if so, where have those studies been done and what is their result?
Yeah, so we've done a number of studies, and one that's actually ongoing that uses those associative methods to look at to look at the decreases in well-being as a result of suffering from gambling harm. And generally, the papers that have been critical of our research have really been opinion pieces and thought pieces that are not actually backed by data. Our replies to those opinion pieces that call some of these harms essentially opportunity costs go with these techniques which look at the association between having these harms, such as having, for example, regrets about how much you spent on gambling, and how that's associated with decreases in people's well-being, even after controlling for obvious covariates, things that might also decrease your well-being, such as being poor, living in a disadvantaged situation, or what have you. So after you control for those factors, still harm from gambling as measured in these ways, including harms that are associated with that are called opportunity costs, fit very well with decreases in your well-being. In addition to that, we have an article by a student of ours, Boyle, who looked at a set of gambling harms that anybody would call harmful, that they can't be considered opportunity costs. They're really severe things like losing your job and this sort of things. And he had that set of what we call unimpeachable harms, and then he had the set of harms that others have derided as "quote unquote" opportunity costs. And basically, we found a perfect correspondence between admitting to some of these lower level harms and also being more likely to suffer from these harms that anybody would say were severe. So the idea of these lower level harms being opportunity costs is somewhat disproven, or we think completely disproven, by the fact that if you say that you regret how much you spend on gambling, you're also much more likely to say that you've lost your job because of gambling, that all sorts of bad things that have happened. It doesn't necessarily mean that you've suffered those more severe harms, but I have a statement that probably won't help the commission too much because it's a bit pointy-headed, but I say that harms are a unitary construct. That is, if you're harmed by one part of gambling, it's very likely that you're harmed on some other part of gambling. And so whenever we look at this, all of our harms that we measure, if you're suffering from one harm, it's much more likely you're going to be suffering from any one of the other harms. And so the argument that these are just opportunity costs from that standpoint just doesn't hold water. It's not consistent with the data. And again, our critics talk about hand-waving arguments about about ideology and those sort of things, and what they feel is right or they think is their opinion, but they haven't provided data to undermine our central premise. The data just at this moment does not exist to undermine our central premise that harms is suffered by people who are not necessarily experiencing gambling problems.
And so just going back to the point of data again, has the methodology adopted by Brown been used, to your knowledge, in other countries? And if so, what has that shown?
Yeah, so it's been used in Finland, and it's shown exactly the same results. And we have, we have published results that we're co-authors on from data in Finland. I know it's being used in finding similar results. I don't know if it's published yet in Massachusetts in the United States. And it's been used, our own research has been conducted in New Zealand and has found almost identical results in New Zealand in terms of decrements to well-being based on the same methodology.
All right. You mentioned in the earlier part of your introduction, you were talking about your assessment of benefits, and you mentioned the study that you had conducted in Tasmania, and that's in your report as well. It says that on the two different ways of calculating, it's either no change in net benefit or a small decrease of 2% in net benefit. Are you aware of any studies which suggest that there is a material increase in net benefit as a result of gambling?
I'm certainly not aware of that, other than some early social impact assessments have suggested, and again, this is something that I don't I only have vague knowledge of, I'll share it with you anyway, which is that gambling as a industry has been quite good for Las Vegas and quite bad for New Jersey, and so there have been different impact assessments that have sort of had that sort of summary assessment. But again, I think those impact assessments, which again I think are really good. There's Williams in particular in Alberta has a methodology for a particular methodology for doing social impact assessment on gambling that is excellent, and is being repeated in Massachusetts. And those impact assessments are good, but they tend to provide a mixed bag. And again, the mixed bag creates this, and I think I saw this, with respect in Philander's discussion. It creates the idea that there's just a whole bunch of stuff going on, and we can't be sure, and therefore the answer is to do nothing. I don't think that's morally defensible myself. I don't think that it's morally defensible when people are being harmed to say that we won't try any of these things until we get perfect evidence 100 years from now, and meanwhile we'll just let people continue to be harmed by the product. This is, and it's important for me to say this, is that this is not to say I'm anti-gambling. It sounds like I'm anti-gambling, but I'm not. I'm up about $1,000 in Vegas, so I'm not I'm not a person who's who's stridently anti-gambling. However, I think the products should be safe, and they should have safety features, much like cars have seatbelts. The products should be safer. And I think there are things based on first principles, such as pre-commitment, that almost certainly will provide benefits above the risks of unintended consequences that justify their use. I don't think it's necessarily has to be a one-size-fits-all solution, as Philander has suggested. I think people can be, depending on their circumstance, income, credit checks, can potentially gamble at different amounts and be subject to different restrictions based on whether they're living locally or whether they're living abroad, for instance, or in another state and are just traveling as a piece of vacation. So I don't think there needs to be a one-size-fits-all solution, but I think some of these solutions should be honestly tried rather than watered down into the point of uselessness, or not tried at all because they presumably don't have enough evidence to show efficacy at this point.
I have two more questions I'll take you to. The first one you've already touched on briefly when you made a mention to what you had understood Dr. Philander to be saying about the need to wait until such time as things are sufficiently proven. I think you used the phrase 100 years, but I think Dr. Philander said 10 to 20 years in the future it might be the case that there was a better evidence base. That sort of time frame, number one, do you accept that that's a valid / likely time frame? And number two, has this argument been used before in the past?
Yeah, so I think you may be aware, you all may be aware of there's a phrase for nuclear fusion as a new energy source, and they say nuclear fusion is only 20 years away, and it always will be. And I think solutions to gambling problems are the same thing. It's always sometime in the future, and it always will be if we take that position of this is social science. This is not something where we're going to work out the perfect chemistry and find out some result that's going to be within the range of 0.0001 micron of some standard perfection. So when we put off trying these methods for want of evidence, the evidence will never arrive. If we never try pre-commitment, for instance, then we'll never know whether it works. And where it has been tried, again, it's been undermined. So all of these sort of things that you can that you can say, oh, there's not enough evidence for. Well, you can guarantee that won't be enough evidence unless you actually test for it. And yes, this to answer the other part of your question, this has been going on for decades. A delay in implementing pre-commitment. Pre-commitment, the basic idea has been around for at least 20 years, if not longer. And hasn't been honestly tried yet. So tell me when it will be tried. Will it be another 20 years? I doubt it. The way we're going, I don't think it will be, unless somebody decides to make a change. Somebody has to stand up and say, yeah, we're going to actually try this. And if it honestly doesn't work, well, then we'll know. But at the moment, there's no way for us to honestly know because it's a lot of these solutions have honestly never been tried.
That then takes me to my final point that I wanted to raise with you, and that's in relation to some of the specific measures. You've just been talking about mandatory pre-commitment, and I just want to understand when you say it's never been tried before. I had been of the understanding that the system was in place in Norway. Perhaps you can explain if it is, and if it's not a mandatory pre-commitment system, what's different about it there?
Yeah, look, I'm going to have to defer on that because I'm not that aware of how it works in Norway, and so I couldn't really comment.
Okay. Then the final question I had, which is again in relation to particular measures that may be things that can be tried for the purpose of harm minimisation. This is something that's picked up in your report and responded to by Dr. Philander, but hasn't been mentioned so far this morning. It was just in relation to the issue of entry fees to casinos. One of the things that you propose in your report is that it may be appropriate to have entry fees that are imposed after a person's had a number of visits to a casino. Can you just explain to us the reasoning behind that proposal, which I don't believe was responded to by Dr. Philander?
Yeah, that's right. So the idea here would be, I mean, the problem with imposing fees upon entry to the casino is that it becomes, aside from the fact that it interferes with people's freedom of choice, which I think is an issue Dr. Philander raised. Actually a reasonable issue, which is that I generally believe freedom of choice is probably a good thing. It might be my American background, but that's what I believe. But certainly when you impose, a fee upon entry, you start out with a built-in loss, and people on their visit may try to make up that loss during that visit. I mentioned that. Dr. Philander, I think, mentioned that as well in his submission. So one of the potential fixes to that, though, is we're not necessarily trying to get people not to visit the casino. That's not the point, or to not gamble. The real issue is spending too much time, or spending too much money. That is the source of harm, also the source of gambling problems. And in order to do that, you could find some limit to which it is reasonable to visit the casino. So one suggestion based on some low risk limits, for instance, that people have explored is no more than 4 times a month. So that would be like once every weekend that you would visit the casino. That would be a lot, frankly, for most people, because it's a lot of money. It's an expensive hobby for people who are, or leisure activity for most people. But nevertheless, 4 is a lot. Maybe if you visit over 4, and again, this would have to be tracked by all gambling being on some kind of identifying criteria, a card, or either at entry or while you're actually playing. That if people visit over 4 times a month, they can still play. That's, again, allowing people to have freedom of choice in their own behavior, but that they would have to pay an entry fee after, let's say, the 4th visit. So I'm not saying, hey, 4 is the right number. I'm just proposing that as an example of the kind of limits that you can put on that will discourage people not from gambling, but from gambling beyond reasonable means for most people.
Thank you, Professor Rockloff.
Mr. Dunn, is there anything you wish to take up with Dr. Philander at this stage?
Yes, a few matters, if I may, Commissioners. Dr. Philander, you've heard Professor Rockloff make certain statements about your thinking in relation to testing for 10 or 20 years. and then it was suggested in the course of his evidence just now that it might be 100 years. What is actually your position with respect to testing particular measures in relation to the responsible service of gaming?
I think what I was trying to articulate initially, and I apologize if I failed to do so, was that my primary concern was that a certain measure, a certain intervention might be put in place with limited opportunity to modify it or pull it back if it's ineffective. And so, the amount of time that it would take to thoughtfully go through many of those interventions is probably a 10 to 20 year period if it's designed through an iterative process where we look at specific aspects of it, roll it out, but have the opportunity to modify it if that makes sense. One of the challenges that I often find in policy situations is that something gets changed and then it's very hard to change it back. And so that's my concern. If we're truly trying to create an effective intervention, that it should be something that is explored on a stage basis and with great care to evaluate whether it's effective and whether or not there's unintended consequences of that intervention as well.
Okay. You don't espouse the informed choice model as the only tool for policy making, do you? So
I think maybe to clarify what we mean by tool and by model and all of these ideas. So from a high level perspective, I think it's important to understand the social context in which we explore these gambling models. So we start from a place of having no gambling regulation whatsoever is probably a bad idea because that leads to an illegal market. And that having some sort of legal gambling becomes makes the most sense from that point forward. So now, on that premise where we have legal regulated gambling, what's the best solution to mitigate harms that might occur in that environment? And I think a model that uses aspects of informed choice, but also adopts ideas from public health, a type of hybrid model where we identify different roles for different stakeholders and they all work towards a common goal. I think that's a model which might not have a specific label, but is one that makes sense from a public policy perspective. Then when we start to think about tools that we might use, I start to think about that as a more tactical approach to interventions. And those things might be quite varied, and there's some that I think there's clear evidence for, like self-exclusion programs, but then there's others that are yet unexplored that may be effective, but I obviously have concerns that they might be flawed in many ways that might be irreversible if we make bad policy decisions.
What's your current thinking on pre-commitment as a tool or a technique?
I'm open-minded about it. I think so. Just to provide a little bit of background, I helped evaluate the pre-commitment system that went in place in Nova Scotia called the My Play program, and then I helped British Columbia in Canada. Nova Scotia is in Canada as well. I helped British Columbia identify the pre-commitment budgeting tool that went in place in that environment. And my perspective on it right now is that it's not obvious one way or another whether it's effective. I think based on my experiences, just looking at the technology, that the user interface and user experience from a consumer standpoint of these machines, it's so poor that I don't know what an actual good system would look like. Part of that is because of the nature of the gaming industry and the regulatory processes that make it so hard to actually innovate as far as technology is concerned. So like in this case, the heavy regulation that exists around gaming equipment manufacturing is in some ways holding experimentation around responsible gambling back. And so, to answer your question more directly, it's unclear to me, how effective it would be.
Thank you. You would have heard the exchange just now between Councillor Sisting and Professor Rocklov in relation to the treatment of the approach to harm that Dr. Rocklov advocates in the works of other academics, including Professors Del Fabro and King. Professor Rocklov treated or dismissed those as opinion pieces. Can you tell us what the state of the literature is with respect to the views expressed by Professor Rocklov and others on harm, and how others in the gambling academic study view those matters?
Yeah, I mean, I would characterize it as that of a sort of a new and growing subfield of gambling studies. And, I think that Dr. Rockloff's initial paper, Brown et al., was a very interesting study from an academic perspective. I think it was, seminal in many respects to this field. But I think like any new domain of science, social science, there's a lot of debate that needs to happen within academia, both around the margins, but also around sort of the middle of a lot of these ideas. And so I think the way that I would characterize the field right now is that I think everybody recognizes that there's a lot of potential in this work, but there's still a lot of disagreement around what's the right way to approach a lot of these questions. And I think that's something that obviously Dr. Rockloff's putting a lot of time in, but others are too, who disagree with a lot of his perspectives.
Thank you. Dr. Philander, you have addressed in your report, but didn't have an occasion to speak about it in your short presentation, the question of industry funding and how that may affect studies and the perspectives of academics. Could you shortly summarise your views on that?
Yeah, so there's a couple things. So, first I'll just say this quite clearly. For everybody that Dr. Rockloff identified in his report, and kind of more broadly speaking, I don't see any evidence that industry funding is creating biases or conflicts in the actual work that's being published. Certainly not with, Dr. Blazinski or Dr. Noer or any of the other people who are part of the Reno model or the RGAP. I think, the field of gambling is challenged in that, unlike other fields like drugs and alcohol, there's a lot more government funding that goes directly to national bodies of science, which then funds research, which then filters its way down to researchers. That doesn't necessarily exist in the same way for gambling addiction. I think part of it is because it's a field that's much newer than those drug and alcohol fields in addiction. And so, what you see is sort of the most influential researchers, some of which I've just named, who've created the most impactful work, funded their work with money that came from the gambling industry, not because, and I don't think that shaped their research in any way. I think it's just a function of the system in which gambling exists, which is different from other like health-related fields.
Thank you. Nothing further, Commissioner.
Thank you. Could I just check? It's about 9:35 a.m. where we are. Professor Rockloff, I presume it's 11:35 a.m. where you are, and 5:35 p.m. where you are, Dr. Philander.
That's right.
All right. We'll take a break now, and come back. We'll take 20 minutes and come back at 5 minutes to 10 our time, which will be 5 minutes to midday and 5 minutes to 6 p.m. I think, where you are. Is that convenient? So 20 minutes. All right. Thank you. We'll come back at 5 to 10.
All rise.
Please be seated. Thank you, Dr. Philander and Professor Rockloff. Professor Rockloff, I'm now going to invite Mr. Dharmananda to explore matters with you that relate to the interchanges between you and Dr. Philander.
Thank you, Commissioners. Professor Rockloff, we have your report, which has been tendered to the Commission, and on the cover page, it's headed Gambling Harm and Harm Minimisation in Western Australia Expert Opinion. That's correct, isn't it?
Yes.
And you've reviewed that report for the purpose of your giving evidence today.
Yes.
You were engaged by the PCRC by a letter dated 11 October 2011, which was the subject of your identification earlier in the morning.
Yes.
You reviewed that letter carefully before completing your report.
Yes.
You were asked to provide an independent expert report,
Yes.
and certain duties are set out at PCRC.0022.0001.0004 at
Yes.
paragraphs 8.3 and 8.4. You see that?
I did.
Did you comply with those aspects in 8.3 and 8.4?
Let me read it.
You can read that as together with 8.2 if you would.
Okay. Yes.
Where is the statement required by 8.2 in your report?
Um, well, I may not have a specific statement on that. I think the closest would be, as the lead author, Professor Rockloff confirms that he has reviewed and all documents provided.
So you identified yourself as the lead author. There were other authors identified in the report.
Correct.
8.4G required you to identify the other person and the opinions of the other person in your report. Have you done that?
I'm sorry, what other person?
The other persons listed at the cover page of your report. The various other persons who are seen as contributors to this report.
Yeah. I consider, I consider those persons to be joint authors of the report. We have all read the report, and we all accept the opinions expressed within the report as consistent with our views.
So you're able to speak on all of the matters within the report, and you haven't concluded an exercise of identifying who contributed to particular parts of the report. Is that right?
That is correct.
Did you draft the whole thing from cover to cover then, Professor Rocklov?
I did not.
You were asked earlier this morning about Norway, and you said that you had to take that on advisement because you were unable to answer it. Do you recall that?
I do.
You were specifically asked about the example in Norway in your brief, and you were unable to deal with it. Was that dealt with by someone else?
I'm not aware that it's in the report.
It's mentioned in your brief, one of the questions.
Okay. Well, I suppose we didn't do that then.
Were you the only person directly engaged by the PCRC?
Was I the only person engaged by the, my understanding was that the agreement that we entered into through which we got our funding was with the university and not myself personally.
So this letter of engagement is directed to you at the Experimental Gambling Research Laboratory at the Central Queensland University.
Yeah.
Is the funding, therefore, is the amount to be paid with respect to this engagement to be paid to the university?
Correct. It has been paid to the university, to my knowledge.
And therefore, every member of the Experimental Gambling Research Laboratory has contributed to this report, and you're unable to tell us who wrote which parts.
Well, if you bring up particular parts, I can probably recall who authored particular parts, but it isn't specified in the report.
Thank you. I want to deal with the conceptualization of gambling-related harm now. In your report, you distinguish between measuring the prevalence of problem gambling as diagnosed using the Problem Gaming Severity Index, or PGSI, and gambling-related harm more broadly, do you not?
I'm sorry, can you restate that?
In your report, you distinguish between measuring the prevalence of problem gambling as diagnosed using the PGSI and gambling-related harm more broadly, do you not?
Yeah, so gambling-related harm can be measured differently than problem gambling is measured by the Problem Gambling Severity Index.
And you say that most harms produced by gambling are suffered by people who do not have a gambling problem.
That's right, the quantity of harms in total in the population.
And you cite 3 studies for this opinion, and those are studies by Brown and others in 2016, Brown and others in 2017, and yourself in 2020.
Correct.
Correct? These studies were all undertaken by you or your team at CQ University?
Correct.
And the extent to which harm is found to be suffered by non-problem gamblers depends, you'll agree, upon the criteria and thresholds used to define harm.
Well, the criterion, so we don't view harm as being thresholding, and that's been a consistent problem and misunderstanding of some of our critics in the industry or in academia rather. So problem gambling is thought of in a quantitative sense, which is that you either have a gambling problem or you don't have a gambling problem. You score 8+ on the PGSI or you don't. In terms of being harmed, we define whether you're harmed as to whether the amount of harms that you identify are associated with decrements to health and well-being. If they are associated with decrements to health and well-being, well, then you're being harmed, at least by degrees. And if you're not, you're not. There is a point at which people can be harmed by gambling, but they're also benefited by gambling. That is, gambling's fun, and it's an enjoyable way to spend your time. And so there can be a point at which people can be harmed by gambling in small amounts, but actually their benefits exceed their harms, in which case that may be a rational point of consumption. So the point at which people are net harmed by gambling is when their harms in terms of decrement to well-being is larger than the benefits, that is the improvements to their well-being in taking part in the activity.
what I was directing your attention to, Professor Rocklov, is that that conception turns upon how you define harm. Do you agree with me?
I don't know what you're saying.
I'm trying to give you an example, is that if the relevant criterion for the identification of harm is defined in a particular way, then you may say that almost all gamblers will experience some harm.
Is defined in what particular way?
In the way, the way that your study seeks to define the potential harms.
No, that's not correct. In fact, we find the majority of people who use our most common metric for exploring harm, which is the short gambling harm screen. The vast majority of gamblers have no harms whatsoever, at least as identified by the short gambling harm screen. And in fact, when we use the short gambling harm screen and we compare it to the problem gambling severity index, it's more likely that you're going to score one or more points on the problem gambling severity index than you score one or more points on the harm screen. That is, the problem gambling severity index, which is a long-standing 20-odd year old screen that is a standard in terms of determining, at least in population sense, whether you have gambling problems, is more sensitive in picking out people with gambling problems than our harms is in picking out people who have been harmed, at least according to the short gambling harm screen. So this notion that the way we do research identifies everybody as being harmed is just verifiably incorrect.
Your team developed a list of 72 potential harms.
Yes.
You've used versions of this list or a short form of it in each of your 3 studies.
Yes. Well, not all 3 studies. Sorry, in the original study, I think it was the 2016, we actually asked people every single harm. It was probably brutal for them, but that's what we did.
And those harms in the list of 72 range in seriousness?
Yes, they do.
There are severe items like bankruptcy or attempted suicide, correct?
Correct.
And then there are items such as the reduction in your available spending money, correct?
Correct.
A reduction in your savings.
Correct.
Less spending on recreational expenses such as eating out, going to movies or other entertainment.
Correct.
Having regrets about the way you felt in relation to your gambling.
Yes.
The reduction in time attending non-gambling related social events.
Sure. I don't remember that one in particular, but okay.
Eating too much.
Yes.
So this conception of harm is broad.
Yeah, and so the conception of harm that we took, and this is a conscious choice on our part, is we went through the literature and found every single instance where people mentioned, or at least that we could find, where people mentioned harms related to gambling. We also asked gamblers themselves about how they were harmed from gambling. And then we compiled a list as large as possible of the different ways that people could be harmed. A lot of that list had repeats in it, basically harms that were similar in some way to the way people expressed other harms. And so we reduced that set to come up with 72 as broad and unique harms that we could in identifying people with gambling problems. The idea behind that being that we didn't want to impose our views about in an arbitrary way about what is harmful as related to gambling, but instead let people choose for themselves whether they think that they were harmed by gambling on all of the criteria that people in the past have said that they were harmed by gambling, and then see if the association with those harms is related to decrements to well-being.
And you've mentioned association previously. you use that word advisedly, do you not, Professor Rocklove?
I don't know what you mean by advisedly.
I mean that you're not suggesting a causal relationship, are you? Or are you suggesting that?
Well, I think, it has to be, I mean, the inference is that it will be a causal connection, but of course, in the science that we do, it's only an associative relationship that we can find between harms and whether people have decrements to well-being. Unless, aside from the other techniques that we use where we actually have people fill out the elicitation protocols where they actually say, hey, I've been, because of my gambling, my well-being is less or more as a result of my gambling. But again, that's the part that we used in Tasmania, and it's probably a more minor technique that we've used. But again, shows similar results to our other associative techniques.
Do you agree that certain items on the list, such as a reduction in spending money or less spending on eating out or going out to movies, can be viewed as diversions of expenditure and could be categorized as opportunity costs?
Yeah, for sure. They could, but again, when we ask these questions, we ask them in the context as a result of your gambling. So it's not just sort of asked in no context. And the context is as a result of your gambling, have the following things happen to you. And I'm using obviously I'm not using exact words that we used, but what we find is when people check off those harms, that those harms again are associated after controlling for other things that might affect your well-being, are associated with decrements to people's well-being. So yes, even though they could be opportunity costs or things that are non-serious, in practice, and given the context in which people are being asked these questions, when they check them off, it turns out that at least at a population level, within the samples that we draw, that those people who identify those harms are having lower well-being than others.
Professor Rocklove, your studies, including your 2020 study, found that the proportion of gamblers reporting harms rose significantly with each PGSI risk category. Correct?
Say again, sorry?
The proportion of gamblers reporting harms rose significantly with each PGSI risk category.
That's correct.
And most common items reported by low-risk gamblers were matters such as the reduction in spending money or savings and having regrets about gambling.
Yes.
Most more serious harms, like spending less on essentials or not attending to children, were rarely reported by low-risk gamblers, correct?
Well, it depends on what you mean by rarely. Individually, rarely, yes. In terms of population, rarely, no. So more severe harms are still reported largely, except for some extreme ones like suicide, ideation, that sort of thing. But by and large, most harms, and even the more severe harms, are as common or more common in the population of non-problem gamblers than they are of problem gamblers. And again, individually, yes, it's less likely that you're going to be nominating a severe harm if you're a non-problem gambler. However, because there are a lot more non-problem gamblers, in fact, the severe harms, such as losing a job because you're gambling, is often happening to people who are non-problem gamblers, and because there are just more of them.
But the rate is still low. You agree with me?
Individually, the rate is low. Population-wise, the rate is not.
Well, let's look at your table on page 11 of your report. Problem gamblers amongst gamblers is 0.9%.
Yes.
Moderate risk gamblers is a small percentage still at 3.9%. You see that?
Yes.
Low risk is at 99.4%.
Mm-hmm.
And non-problem gamblers is the remaining 85.9%.
Yes.
And that those figures are even lower when you consider that as a percentage of the population as a whole, as opposed to gamblers.
Correct.
Your team conducted another survey in 2019 on behalf of the New South Wales Responsible Gambling Fund. Correct?
Yes. Correct.
The objective of the Responsible Gambling Fund is to play a key role in advising the New South Wales Government on the allocation of funds for initiatives that promote responsible gaming and help reduce gambling-related harms. Is that correct?
I'm not aware of that, but that sounds like a mission statement that they might have.
Is that fund administered by trustees who make recommendations to the Minister?
I'm not aware.
Do you know who the current trustees are?
I do not.
Professor Paul Del Fabro is one of the trustees. Were you aware of that?
I was not.
Returning to the survey you conducted in 2019 with money from the fund, that survey included questions about 21 items of gambling-related harms, correct?
Correct.
Those 21 items were selected by a departmental steering committee from your broader list of the 72, is that correct?
Correct.
The steering committee did not consider appropriate to include many of the lower-level items used in your broader list, correct?
I think they my recollection is that they included all of the short gambling harm screen items on that list, but they wanted additional items as well. I could be wrong. Maybe they excluded some of those items, but my recollection is that most or all of those items from the short gambling harms screen were included in the questionnaire, and then they wanted additional items on top of that.
Shall we go to that report, please? CRW.701.010.7469. The relevant list is at 7525. You'll agree with me, Professor Rockloff, that it doesn't have the regret item of loss, nor indeed the spending on less money to spend on other matters such as going out or going to restaurants.
Yeah, it doesn't seem to be in that table. It doesn't mean that it wasn't part of our data set. I'm not sure why that is not in that table, but I agree it is not in that table.
Thank you. Now, in that survey, among all respondents, only 2.94% of people reported any gambling-related harm. Correct?
I'm sorry, where you...
7527.
Say again, sorry?
Page 7527, operator.
Yep, that's what it says. All right.
And most reported harms were about feeling depressed or distress about gambling and loss of sleep. Is that correct? Is that accord with your recollection?
Look, it's consistent with my recollection, but I couldn't tell you precisely, but it seems like it would be likely.
And of those that had gambled in the last 12 months, 6.34% of gamblers reported harm, with only 2.47% experiencing just one form of harm. That was your finding, wasn't it?
That sounds like it's probably right.
And the mean number of harms experienced were markedly higher among moderate risk and problem gamblers, than non-problem gamblers. That's at 7528, correct?
Yeah, that's correct.
You mentioned some academics who have questioned your team's research in relation to harm and whether it provides strong evidence of genuine cases of harm being more numerous in lower risk populations, correct?
Yes.
Professors Del Fabro and King from the University of Adelaide have published a number of journal articles on this topic, correct?
Yes.
In 2017, 2019, and 2021.
That sounds probably correct.
Do you need to look at those, Professor Rocklov?
No, I don't need to look at it. I'm just saying, I don't remember the exact dates of their articles.
Are you aware of these publications?
I am.
Were you aware of these publications at the time you finalized this report?
Of course.
You do not refer to a single one of these publications in your report.
Well, it probably would have been good if I did.
In your report, you declare that you've made all desirable inquiries. Do you recall making that declaration?
I do.
And you declare that no matters of significance which you regard as relevant have been withheld from the Royal Commission. Do you recall that?
I do.
But you did not inform this commission about the work of Professor Del Fabro and Professor King and their questioning of aspects of your approach to measuring gambling harm, did you?
I suppose I didn't. It wasn't an intentional omission, but it's an omission nonetheless.
Professors Del Fabro and King point to another study conducted by Professor Blazinski and others for the Responsible Gambling Fund in 2015. Are you aware of that study by Professor Blazinski?
I'm not.
Perhaps I could take you to the work of Professor Del Fabro and Professor King in 2019 that has some regard to the work of Professor Blazinski. Go please, operator, CRW.701.010.8650. Are you familiar with this piece, Professor Rocklov?
I am.
We go please to page 8655. And the last paragraph on the page, operator, if you would blow that up. And allow Professor Rocklov also to read the first paragraph on the next page.
Yes, I've read it.
So, having read that, can you confirm then that the respondents who are asked to rate their severity of their problems from 1 to 5,
Yep.
and Professors Del Fabro and King note that once weighted, there did not appear to be very much harm of any sort reported by non-problem gamblers in the study.
Yeah. Look, I am aware of the gambling effects scale, and unfortunately, you've caught me at a bit of a loss of memory, but my understanding of it was that the scale was developed in a manner to produce the result that they hoped to show, which was to show that problem gamblers were not experiencing harm. So it was constructed with the express goal of making sure that that non-problem gamblers would show up as not suffering from harm. So in essence, to put a to underline that, I don't accept that the gambling effects scale is a good way of measuring harm. I think it's a very complicated measure that was constructed with a specific purpose to produce a result, which, in contrast to our harms work, was not. It was, in fact, we were surprised by the result. This was not a result that is gambling harms being more prevalent in the non-gambling population. It was not constructed for that purpose. We didn't even know that was going to happen. It was just an exploration with a result. My opinion of the gambling effect scale is that it was produced with the purpose of producing a result that they wanted to get, which was to undermine the notion that there could be harms outside of problem gamblers.
So let me be clear, Professor Rocklog. You begin by saying that your memory fails you, correct?
Yep.
But yet you are prepared to assert that Professors Del Fabro and King entered into an exercise to skew the results. Is that what you're saying?
Yes, I mean I don't think it's I'm not accusing them of dishonesty. I'm accusing. I would say that the exercise was constructed in such a way that it confirmed their presupposition about what the results were going to be.
And you didn't refer to Professor Blazinski's study in your report either, did you?
I did not.
Move then, Professor Rocklog, to the informed choice model. And your report identifies that the informed choice model is one of three overarching approaches to gambling harm minimization.
One of three, did you say? Oh, yes, I know what you're saying. Yes, that's correct.
Is that a part that you didn't write?
It is. That's a part that my colleague Nearly Hen wrote.
And your colleague cites for that proposition her own work at page 15, line 205. And that's a reference to your colleague's work, The Responsible Conduct of Gambling Study, which was published in 2020.
Yes.
And in that study, Professor Hing posits that there are four models which are actually points on a continuum. That's correct, isn't it?
Yeah, I think that would be a fair characterization.
Have you read Professor Hing's work?
Of course.
That continuum begins with the caveat emptor model, which effectively provides little or no protection for the consumer, correct?
Correct.
Then there's the informed choice model, which provides measures to protect consumers, which are now standard across most jurisdictions.
Correct.
And the next model on the continuum is harm minimization, correct?
Correct.
And the harm minimization model includes measures implemented under the informed choice model.
The which model? Sorry, say again.
The harm minimization model includes measures implemented under the informed choice model, correct?
There may be some crosstalk between the two, yes.
Well,
Sorry,
let's
Mr.
see.
Darmalander, I missed the first one. You said the first in the continuum. Could you just...
Caveat emptor. Well, let's go to Professor Hing's work. CRW.701.010 8755. The relevant passage is at 8774. Second full paragraph, I beg your pardon, the first full paragraph on that page. You see that Professor Hing opines that in addition to practices implemented under the informed choice model of RCG, the harm minimisation approach includes measures to prevent or ameliorate gambling across the spectrum of gamblers. Do you see that?
Yes.
And the next model of consumer protection includes measures implemented under the harm minimisation model. The next model is consumer protection. It's on the same page, further down the page. So each model builds on the measures used by the previous model, does it not?
Well, from my understanding, I think that each model introduces new potential, potential interventions that are consistent with the model's composition.
I'm asking you, Professor Rocklaw, whether you agree, based on Professor Hing's work, that each model builds on the measures used by the previous model.
I couldn't tell you.
You couldn't tell me.
No.
The models are not inconsistent, are they?
No, they're not entirely inconsistent.
Now that's a point made by Professor Blazinski in a paper written in 2020, is it not?
I couldn't tell you.
Are you aware of a paper entitled Considering the Public Health and Reno Model's Strategic and Tactical Approaches for Dealing with Gambling-Related Harms, published in 2020?
I am not.
Go please to crw.701.010.2747. Published in the International Journal of Mental Health and Addiction. Are you familiar with that journal?
Yes.
We go please to page 2749. And the paragraph, the second full paragraph, please, operator. You see there it's stated that the Reno model essentially represents a focused and tactical subset of a global strategic public health model. You see that?
Yes.
So that's in conformity with the views of Professor Hing that I just took you to. Is it not?
I couldn't tell you.
And I'd like to deal with another topic, please, Professor Rocklaw, which is industry funding. Your report refers to the RGAP panel of academics engaged by Crown. Does it not?
Right. Yes.
Were you the author of that part of the report?
No. Professor Hing was.
The members of the RGAP panel are Professors Blazinski, Del Fabro, and Nawa. Correct?
Correct.
They're all academics who regularly publish in the area of problem gambling. and responsible gambling measures, are they not?
They are.
You do not question their integrity, do you?
Absolutely not.
You and some of your co-authors have collaborated with them.
Correct. I recently published with Blazinski, in fact.
And Professor Hing has also worked with Professor Del Febro and Professor Blazinski.
Correct.
And Associate Professor Russell has worked with all three of the members of the RGAP panel.
Correct.
Your report questions Professor Blazinski's research contributions on the basis that he's received funding from the gambling industry, does it not?
I believe it does, yes.
Professor Blazinski is an academic with the School of Psychology at the University of Sydney.
Well, he's now a emeritus professor, retired.
If I could go please to CRW.701.010.8994. That's Professor Blazinski's curriculum vitae. And there's a list of Professor Blazinski's contributions in relation to responsible gambling listed. Are you familiar with those works, Professor Rocklaw?
Which works would those be?
I'm asking you whether you're familiar generally with Professor Blazinski's works as they are listed in his resume.
Yeah, generally. I mean, he's known as one of the most prolific and long-standing contributors to gambling research worldwide.
And Professor Blazinski has received government funding for research as well as industry funding.
He has.
And you're aware that he has been a clinical psychologist with over 30 years of clinical work treating problem gamblers and their families.
Yeah, and more than that, he is a principal member of a gambling treatment group that I think he may have even originated at University of Sydney.
And that kind of clinical work would have given him direct exposure to the harms experienced by problem gamblers and their families. Do you agree with me?
Absolutely.
Have you taken Professor Blazinski's clinical work into account when making assertions about the potential for bias on his part?
My assumption of the amount of in fact, I think that the clinical contributions may in fact allow him to have a greater appreciation for harms that are occurring to problem gamblers, because that's mostly what he sees in his clinical practice. So I would say that that would be consistent with his experience.
I'm sorry, Professor Rockwell, that's not an answer to my question. I said, have you taken account of Professor Blazinski's clinical work when making assertions about the potential for bias on his part?
I don't see that as relevant.
You assert that industry funding may cloud outcomes of research.
Say again, sorry?
You have asserted in your report that industry funding may cloud outcomes of research. Do you recall saying?
Correct.
You have not made any citations for that assertion.
Correct.
You have not pointed to any scientific flaws in the methodologies, design, or findings in the research of Professor Blazinski or other members of the RGAP panel, have you?
I have not.
Are you aware of recent studies that suggest that there are no significant differences between the gambling industry and non-industry funded research with respect to the research design and outcomes of studies?
I'm not aware of that.
Can I take you please to two papers and I'll just ask you to examine the abstract. The first is by Schaefer and others, CRW.701.010.8423. Are you familiar, firstly, are you familiar with this study in the Journal of Gambling Studies?
I'm not.
Are you familiar with the journal?
Journal of Gambling Studies?
Yes.
Yeah, I've published there a few times.
Would you read the abstract, please?
Okay.
Does that give you pause with respect to your assertions concerning industry funding and outcomes of research?
No.
Some of your team have undertaken consulting work for industry operators, have they not?
One to my awareness?
I beg your pardon?
Yes.
That is, Associate Professor Russell received industry funding for an evaluation of problem gambling amongst casino employees from the Echo Star Entertainment Group. Are you aware of that?
I am.
And Professor Hing received funds for consulting work to improve RG measures by Echo Entertainment and Sportsbet. Yeah, are you aware of that?
I am.
She's also received an honorarium from Singapore Pools. Are you aware of that?
I am.
Do those matters, in your view, cause the work of Professor Russell and Professor Hing to be subject to the same cloud that you describe in relation to Professor Blazinski and others?
For the work that they did at that time, for certain, it does. Now, I should say that that work was performed prior to them joining Central Queensland University. Central Queensland University does not accept funding from the gambling industry. I have not imposed that on Dr. Russell or Dr. Hing, but they've decided of their own accord that they were no longer accept industry funding for their research.
So this opportunity for bias can be purged, in your view?
Is what, sorry?
This opportunity for bias by the receipt of industry funding can be purged?
Absolutely.
I see. Crown established the RGAP to look at Crown's practices to determine the best practice in relation to RG. You're aware of that?
Yes.
There's nothing unusual about businesses engaging external consultants to advise them, is there?
No.
That's an appropriate step for a business to take if it considers that it would benefit from expert advice.
For the business, yes.
You assert that the work of RGAP cannot be fairly considered as independent because some members receive funding from the gambling industry. Do you recall that?
Yes.
It's usual for external consultants and experts to be paid for their work, correct?
Correct.
Would you agree with me that Crown would not be able to get leading experts to devote time and effort to advising Crown on RG programs without paying them?
Certainly not research experts, no.
So, adopting your thinking, Crown would in effect be precluded to a diminishing pool to obtain independent advice as and when they sought advice from people that received industry funding.
A diminished pool, yes. I don't think it would be impossible to find expertise, however.
They could brief you, perhaps.
They could brief me, sorry?
Would you be able to provide independent assistance?
In an unpaid capacity, I could provide some assistance, yes.
In its 2020 report, the RGAP described the terms of reference for the review. Have you studied that?
In what report again, sorry?
The RGAP's report, the work of the committee that you criticise.
Yes.
Have you looked at the terms of their reference?
I'm sure I glanced over it, but I didn't pay much attention to it, no.
We go please to CRW.507.001.1078. At 1079, that's the terms of reference identified. You see that the RGAP were to review Crown's current RG practices, policies and procedures, identify existing strengths and gaps or weaknesses. Do you see that?
Yes.
And at 1084, you'll see that there are, that's the start of the identification of a number of weaknesses. Goes over the page. Operator, would you please allow Dr. Rocklov to examine page 1085. There were 17 recommendations made. Professor Rocklov, were you aware of that?
I wasn't aware of the exact numbers, but yes, I've looked at the recommendations.
The RGAP doesn't seem to be self-censoring in respect of their advice. Would you agree with me?
I would agree.
The PCRC asked you whether you had any comments on the approach or conclusions of the RGAP's review. Do you recall that part of your brief?
Yes.
In response, you say that a review should instead be conducted completely independently and funded by government and compel industry cooperation and be grounded in public health considerations. Do you recall that?
Yes.
That's not a comment on the approach or conclusions of the review undertaken by the RGAP, is it?
It is not.
It is in effect a recommendation that the government should conduct its own review.
Correct.
You were asked whether you had any comments on the approach or conclusions of the review conducted by the RGAP. That's part of your brief.
Yes.
You say that the review proceeds on the informed choice model.
Correct.
The RGAP recommended that Crown consider instituting limit setting for EGMs in Perth, like those required in Victoria, and to evaluate the data around this. Were you aware of that?
I don't recall that now.
If I could just refresh your memory, 1137. Does that refresh your memory?
Allow me to read it.
Yes, please.
Yes.
And also recommendation 14, please, operator, which is the next pop-up.
Yes, I remember that in particular.
And also, if I could ask you to examine recommendations 15 and 16, which is on the following page, please, operator.
Yes.
And Ms. Wren informs me that I need to show you the top of the page, of this page. If we go to that, please, operator. Just the first part of that, please, in blow up, operator. Thank you. So, have you read that now, Professor Rocklaw?
Yeah, but to the best of my ability during that short time, sure.
Yes. So just to recap, the RGAP made recommendations about limit setting for EGMs in Perth, required an evaluation of the data around this. They also made recommendations about the development of a predictive model to identify at-risk gamblers based on individual customer data, such as time spent gambling, money expenditures, and variations in bet size and the like. Did you see that as recommendations just now?
Yes.
And those are all measures which are consistent with your preferred model, correct?
Yeah, to the extent of measuring, look, those are all great, but the question that I would have, and again, maybe you can show me elsewhere in the document that shows this, but I don't see anything in what you've shown me that says what they're going to do with that data. It's all very well to actually, know who your problem gamblers are or who are experiencing harms. But what do you actually do with that information? I don't see any of that there, which isn't consistent with how I'd approach things.
It was part of your brief on the basis of the instructions given to you by the PCRC to make comments on the approach or conclusions of the RGAP's review, wasn't it?
Yes.
But you don't mention these conclusions or make any substantive comment with respect to these recommendations made by the RGAP in your report, do you?
No.
Nothing further at this stage, Commissioners, bearing in mind the directions.
Thank you very much, Mr. Dharmananda. Thank you, Professor Rockloff. Now, Dr. Philander, I'm now going to invite Mr. Lee to explore matters with you that relate to the interchanges that have occurred to date.
Thank you, Commissioner. Dr. Philander, I'll just start by asking you some brief questions about your education and experience. You mentioned in the report that you've provided to the Commission that you have a PhD in Hospitality Administration. Can you just explain, for the benefit of the Commissioners, what areas of study are involved in that qualification?
Yes, so my major was in gaming, and then my minor was economics.
And in terms of where you obtained that qualification at Nevada, Las Vegas University, obviously Las Vegas is renowned as a casino and hotel destination. Is the nature of the studies directed towards the hotel and gaming industry?
The nature of the studies at UNLV?
Yes, that you engage in.
So there would be kind of the general social science related courses, and then there would be some gaming related courses that are related to the industry.
And is the essential point of that qualification to learn how to, and then to teach others how to, operate the industry more effectively and efficiently?
The gaming courses, in some circumstances, would be oriented towards that, correct.
In terms of the other components of the course, did any of them include a psychology component?
Like consumer behavior, that type of work.
All right, but you don't hold yourself out as an expert in psychology.
No.
And you mention in your report that you hold a position as an honorary lecturer in the Department of Psychology at the University of Sydney. What's the nature of any courses that you may have taught in that position?
I don't teach any courses.
Okay. To move now to the nature of harm, and we've talked about that earlier today. You've mentioned at pages 6 and 7 of your report, and I won't take you to that at the moment, some of the articles by Drs. Del Fabro and King responding to the research by Dr. Brown et al. Have you been the author of any reports that engage in this area?
No.
Have you been the co-author of any such articles?
No.
Have you otherwise contributed to research in this debate that's currently unfolding?
Research in terms of
The measurement of
sorry, I just want to be clear. Like research in terms of manuscripts published, or just having discussions with academics about
contribution to published work.
No, not contributions to published work.
Would it be fair to say that you are a relatively recent newcomer to this area of study?
To which area of study?
To the area of the measurement of gambling-related harms, such as is pioneered by Brown et al. In 2016.
So I would have read all of this material as it was published, and so it's a relatively new area. So I don't know if that's a fair characterization.
If we can please call up pub.0018.0011.002. And if we can please zoom in on the top half. Now, Dr. Philander, this is a screenshot taken from a Twitter account which shares your name, that is Khalil Philander, and the Twitter account name is @Khalil Philander. Do you have a Twitter account of that name?
That's me.
And looking at the screenshot, can you confirm whether this is your account?
It is.
So looking at the first tweet at the top of the page, there's a request there for recommendations for readings in relation to the measuring of gambling harms. Do you see that?
I do.
So at that stage, the 23rd of September, is it fair to say that you were not fully informed as to the current state of the literature in relation to this issue?
I was making sure that I was fully informed.
Looking at the bottom of the page, you can see the date there is 23 September this year. So from your answer before, is it the case that as of approximately 7 weeks ago, you were wanting to make sure of your understanding of this area?
Yes.
And looking at the comment you make at the top tweet, after the request for recommendations, you then say a lot of the work I've seen seems politically motivated. What do you mean by the words politically motivated?
I think by politically motivated, I meant it was directed towards a specific policy outcome, as opposed to just trying to call balls and strikes of what harms look like.
Do you consider that work generally, which adopts a public health approach, is work that's politically motivated?
I don't think it would be fair to characterize a large category of research broadly like that.
Do you consider that much of the work in the public health space is politically motivated?
I think a fair way to characterize it is some may be.
All right, so then underneath that, you have a second tweet where you say that what you found worth reading so far, and then you mention the articles that ultimately make their way into your report.
Mm-hmm.
And then underneath that, there's a comment where you say, nothing in USA, surprising considering its importance to ideas emanating from woke culture. By that, do you mean that given the United States is associated with woke culture, it's to be expected that it would have generated some research dealing with the question of measuring gambling harm?
By that, I meant the ideas around woke culture more or less started in American universities. And so, my expectation would be that because some of that literature began in American universities, that we would see more of these types of ideas by American researchers.
The words woke culture were initially used to refer to racial awareness in America, but are now often used as a derogatory comment in relation to people who occupy the left wing. Would you agree with that?
In academic circles, woke culture is the idea started with racial inequity, but it's moved towards inequity for many discriminated groups.
So you're suggesting then that there is inequity or discrimination in relation to measuring of gambling harms? Is that what you're suggesting you were saying there?
No.
So can you explain how you use the word woke culture in relation to measuring gambling harm?
So the idea that I'm trying to get across there is that there is a strong focus among United States academics around certain institutional setups that may disproportionately affect individuals like Blacks or gays or many other discriminated groups. And so what I was trying to articulate there was that it might be interesting from an academic study to see to what extent that some of those ideas of whether there are more harms to discriminated groups or not.
All right, if we can please now call up pub.0018.0011.0004. And if we can please start at the bottom of the page, a bit further down, we'll go down until we reach September 16. All right, stop there, please. So you can see the date there. This is a week before the tweet that we just looked at a moment ago. And the headline is above the box, push to ban credit cards in online gaming. You see that? And then it appears that you've highlighted in blue a quote from the article in that box there. In that sense, it's trying to provide some friction in people's gambling behaviour. Is that correct? That was you who highlighted that?
Correct.
And then above is your comment when you are referring to what the article says. And you ask, have they considered forcing everyone to solve a crossword puzzle before depositing? Do you see that?
I do.
By that comment, you were intending to convey your strong disdain for the proposal, weren't you?
I was not.
What were you intending by that comment?
So that was a pithy comment to force people to think about what we're trying to actually accomplish with gambling interventions. And so in this sense, people often think with responsible gambling interventions that by creating a consumer barrier, this is sometimes called like sludge, which is the opposite of nudge. So a nudge is the behavioral economics idea of changing the circumstances in order to push people towards a behavior. Sludge is the idea of putting some sort of barrier in order to prevent somebody from going into behavior. People often think that that might be a good idea from a responsible gambling standpoint because it might produce an outcome that reduces the amount of spending. But what it doesn't fundamentally do is shape the way that consumers think about gambling. And so obviously this is Twitter, so the context is make pithy statements about the points you're trying to make. But that was the idea, to point out that it's not obvious that these types of interventions are truly accomplishing what we might want to with a responsible gambling program.
All right, if we scroll up the page a little, we'll see the next tweet in the thread. And again, you refer to that thinking as lazy first order effect thinking.
Mm-hmm.
In the final line, you say, if you can't solve a hard problem, make up an easy problem to solve instead. And I suggest again that you were intending by that to convey your disdain for an approach which was a regulatory approach imposed from the top.
If by approach you mean the actual intervention, that's not exactly right. My criticism is more the process.
And when you say your criticism is a process, what is the problem with the process that you identify here?
The process is not starting from first principles and then exploring like the final outcomes of what you're trying to accomplish. So the first principles idea with responsible gambling is, and I think I articulated this a little bit, is providing the right information and interventions that enable gamblers to have the right beliefs and behaviors that will be protective for them over the long run.
I think the next tweet that we're about to look at perhaps calls up what you're talking about now. So if we scroll a bit higher up the page, please. You then have a discussion as to your views as to what RG is, and I assume that means responsible gaming.
Correct.
And you explain it's about informing and empowering gamblers. It's not about imposing a negative externality on every customer. Would you agree that that represents your strongly held view as to the appropriate way to try and deal with gambling harm?
It's a strong opinion weakly held, I think, is the right way to frame it.
When you refer to a negative externality in that tweet, that's a standard economic term for anything that causes an indirect cost to individuals, isn't it?
To individuals that aren't involved in the transaction.
Thank you. So does that mean that to your thinking, the proposal in this specific case, which was about preventing people from using credit cards to bet, that's something that you would characterise as a negative externality?
I think that type of policy would create a negative externality for individuals.
And that would then be, to your mind, in application of standard economic theory, a bad thing?
That aspect of it would be bad.
When you talk in the third line of this tweet, and you say the solution isn't coming out of a single policy meeting or study, it comes from the right incentives and letting a thousand flowers bloom, does that again reflect your starting point, your fundamental belief that it's not appropriate for there to be regulation or limitation imposed out of policies, meetings, or study?
I think the right way to characterize my thinking here is that there certainly is a role for regulation. And I think I articulated this earlier when I said that, having a regulated gambling industry is more effective than having a completely unregulated gambling industry. What I think, having experienced life as a quasi-regulator, being on the academic side and also working with nonprofits, is that the challenge in particular with responsible gambling is that a lot of the interventions have come from the top down. And I think that there's a lot more room for innovation that comes from the bottom up. But because a lot of the actors, the key actors' ability to create those to innovate and be able to experiment is restrained, I think that sort of more captures, my perspective.
So Professor Rockcliffe states in his report that the informed choice model essentially commenced in 1996. You've just said that there's a lot of innovation from the ground up. Can you give the Commissioner some examples of the innovations that you say have come from the ground up, say in the last 20 years?
I did not say a lot of innovations have come from the ground up.
Sorry, I must have misunderstood. What did you say?
I said that the right model that would be effective for helping to solve this problem would be one that allowed for innovation coming from the ground up. And so what I was articulating here in this particular tweet is about creating the right incentives for that innovation.
Thank you. Sorry, Commissioner.
Sorry, I thought what he said was that there is room for
Yes.
a movement from the ground up.
Yes. All right, so there's room and there's movement, an option for movement from the ground up, but thinking about it now, can you articulate anything for the Commissioner's assistance, which you would say is an example of that possibility being realised?
I mean, self-exclusion was something that started in Manitoba, but that was largely a regulatory piece. I think there is some experimentation. Most of it is happening with online operators, and that's around like empowering people to be able to take timeouts or set specific times of day when they might not want to play. You know, if somebody comes home drunk on a Friday, they might not want to be able to do that. But the casino environment is one, and the regulatory structure is one where I don't think that there's been a lot of innovation over this time period that you articulated.
And just to pick up for a moment the example that you gave about online operators, one of the things that you would agree occurs with an online operator is that every patron has an account which allows total tracking of that patron so as to have the possibility of imaginative restrictions, limits and controls to empower that patron. Isn't that right?
That's correct.
And so if you wanted to have the possibility of similar sorts of things in the casino environment, you would likewise need to have the option of that tracking and monitoring in the casino environment as well.
I don't know that well, it depends. So it's something that could be done pseudonymously, or it could be something that's identified or tracked to a specific identification of an individual.
All right. There's just one more tweet I want to show you, and that's pub.0018.0011.001. And it's the pinned tweet at the top of this page, please. I'll just let you read that for a moment. So the essential point that you're making here, when you talk about a claim to focus on consumer welfare in the first line, and in the third line, you say we spend 99% of our time talking about edge cases, but average consumers would be better off with less involvement. By edge cases, are you referring there to problem gamblers?
That's certainly a part of the edge cases.
What else did you include in the word edge cases?
So it could be just, you know, high volume consumers. It could be high rollers, not necessarily
And
individuals that have been diagnosed with a gambling disorder.
Yes, and then
or would be diagnosed with a gambling disorder.
yes. And then the final part of the sentence on the third line, but average consumers would be much better off with less involvement. Does that again speak to your starting point, your philosophy, your ethos, that it would be preferable to have less involvement or less regulation rather than more?
I don't think I've just articulated that I have an ethos of that nature. So I think that's a mischaracterization of what I'm saying. But what I am saying is that the point that I was trying to make here is that in these policy contexts and even in academic discussions, we do spend a large amount of time talking about very small populations of people. And I think in those discussions, which I think are important to have, we often miss the impacts that happen to much, larger population bases.
Thank you. In terms of saying that you miss the impacts on the larger population basis, what metric are you bringing to weigh the relative benefit to some people if there is less involvement versus the detriment to others if there is that less involvement? And how are you forming the view that that is a appropriate or positive development as you seem to be suggesting here?
Sorry, I don't understand that question.
So what you're saying here is it would be better off, consumers would be better off with less involvement. So that seems to be a statement of fact that there should be less involvement in gambling regulation. Do I read that correctly, or have I read that incorrectly?
What I'm saying there is that a lot of the interventions that we talk about do impact the larger group of people. Yeah.
And my question is, in terms of saying it would be better if we didn't have those sorts of interventions, what are the metrics that you're applying to work out the benefit to the larger group versus the detriment to the smaller group, so as to make a choice that it is appropriate to prioritise that larger group?
That's a subjective judgment.
Okay. If we can please now go to your paper, that's at crw.998.002.1212, and I'll take you to page 7 and paragraph 3.2.3. And you can see there that you have in the second line a comment to the effect that you think that you refer to Del Fabro and King's work, and that suggests that Brown et al.'s work is likely to have substantial measurement error. You have that?
I do.
So your conclusion as to substantial measurement error is not on the basis of your review of the data, it's on the basis that you find the argument by Del Fabro and King a compelling argument. Is that correct?
No, that's not correct at all.
Can you run us through how it is that you came to the view there'd be substantial measurement error in relation to the work of Brown?
Yeah, so I actually did articulate this earlier. So what you're ultimately trying to measure in this case is harms, right? And so you're trying to create a metric of harms that accurately reflects individuals' subjective experiences, right? And so what I described, and actually Dr. Rockcliffe also described a different methodology that he used, but was that when you're asking people survey questions, and you're asking people survey questions in a specific way, like as I described earlier, the outcome that you're going to get does not obviously reflect individual subjective experiences about harms, particularly if we think about the way that people actually behave.
So is this a reference to revealed preference versus stated preference? And you made those comments about the way people actually behave?
So, so in some ways it is. I think Del Fabro and King also talked about some other methodological issues where if you change the way that you actually measure these things in terms of like the actual ordinal scale that you would use, sometimes these effects disappear entirely. I'm not sure if that's the right way or if it's not the right way. There's just obviously what it underlines to me is that there's noise. But what could you repeat the second half of your question?
So my question is directed towards the use of the concepts of revealed preference and stated preference, which
yes.
I've interpreted as being in your paragraph, but you'll tell me if I've misread that.
Yes. This isn't necessarily about stated versus revealed preference. I think that's relevant here. I think there are, as Del Fabro and King outlined, other methodological issues. But certainly there are stated and revealed preference differences that are relevant to this paragraph here.
And now my question is in relation to that aspect, which is relevant to this paragraph here. Do you consider it to be valid to use that kind of intellectual framework, stated versus revealed preference, in relation to a question that's not about choosing between options? So as I understood what Professor Rockcliffe explained before, he was talking about people who self-reported a degree of detriment in their life to then calculate well-being. But that's not saying a person is choosing one or the other option, which seems to be where your critique is focused. So is there an inconsistency between what Professor Rockcliffe is saying and the way you critique that?
We're really getting to the nitty-gritty of methodology here. The idea of revealed preference is that we can make inferences about people's values of certain consumption experiences or certain, it doesn't even have to be consumption experiences, just different decisions about how they live their life. We can, if we know the way that people make specific decisions, we can infer the extent to which they value those things. Stated preference is basically something similar to this survey tool where we're asking people to make decisions either asking them to tell us directly, did you experience harms? How were they? Or giving them different choices and seeing how they deal with those hypothetical choices, and then inferring from those decisions what we might estimate for those harms to be.
I'll put this bluntly because perhaps I'm not being clear, but if you're asked a question to the effect of, has gambling made your life worse? That answer is not an answer which then selects between two options so as to bring in the notion of preference.
I think that's a fine question to ask.
And so what's your response to that question? So do you accept that the result of a question which asks about whether or not gambling has harmed a person or whether they find their life has been made worse, do you accept it's not appropriate to analyse that data by reference to a stated preference versus revealed preference framework?
That's not a relevant question to the stated versus revealed preference framework. So that question is just asking, a binary thing. It's not asking somebody, you're not trying to infer some sort of quantitative number about relative harms from that question directly.
All right.
I guess that's where I'm getting confused.
Yes. Looking at the words after the underlined part of the paragraph there, you say you don't find the self-reported approach by the authors to be convincing, based on your understanding of economic and consumer behaviour literature, and then you go on to say individuals feel and behave differently how they respond. So that is recourse to a economic framework or intellectual framework to respond to data that was measured by Brown et al., isn't it?
So, what it is me relying on economic consumer behavior theory rather than empirical estimates, to which I'm skeptical.
What I'm saying is you have taken an empirical estimate, you have said economic theory suggests that that is unlikely to occur, and your conclusion has been where the attempted measurement of reality and theory don't match up, theory must be right.
That's incorrect.
Can you talk us through how you say that those two different concepts have been used by you in this paragraph?
Yeah, so what I'm saying is that I find that the empirical estimates that are produced here were done using a methodology which I find will produce unreliable outcomes in terms of the actual empirical estimates. And so that's one piece. And then the second piece is that also doesn't align with theory. And so it's not one versus the other. It's that I actually find two pieces of evidence to be in conflict, or two pieces of evidence that just don't rationalize what Rockloff had articulated in his report.
Thank you, Dr. Philander. If we can please go now to pages 9 and 10 and have those side by side. You can see, starting at the bottom there, paragraph 3.6.1, you start by saying it may be the case that some non-problem gamblers experience gambling harm. Do you see that?
I do.
Are you suggesting by that comment that you have yet to be persuaded that harms can be experienced by anyone other than problem gamblers?
No. I think that's probably just a phrasing issue.
Okay.
Yeah.
Then you go on to say in the second part, which has been blown up, thank you, operator, that for reasons you've explained related to economic theory, your opinion is that non-problem gamblers typically do not experience net costs. And so again, this comes back to the notion that these are rational actors. They chose to undertake a particular leisure activity, and the fact that they chose to undertake it demonstrates that they valued it more than the next alternative. So it must be the case that they actually experience benefits overall. Is that a reasonably simplistic way of phrasing the argument?
It is.
The approach that you've adopted here in taking that argument is focused very much on the gambler themselves, isn't it?
Sorry?
By that I mean any harms that may be experienced that you are considering in your analysis here, you're looking at the harms that may be experienced by the gambler themselves, because you're weighing it against the gambler's choice to undertake that activity.
Yes, yes.
And so it doesn't take into
Here we go.
account harm that may be experienced to other persons related to the gambler, such as family.
That's correct. That would be a negative externality.
So if it was the case, to take an example, that a person who is not a problem gambler, not a regular gambler, gambles very heavily one afternoon, blows the paycheck, and is no longer able to pay for the family holiday, whatever degree of harm is experienced by the family is not accounted for by the way you're approaching this reasoning.
Yes, in that hypothetical situation, that would be a cost that is not captured by the gambler themselves.
Do you think that that might suggest that there's difficulties in approaching the analysis that you've undertaken with the rigidity of recourse to classical economic theory and having that as the only way you approach the issue?
I don't think that's the only way I'm approaching the issue. The challenge is in the comments that I was trying to make there is that when we're talking about gambling related harm and a disproportionate amount of the harms coming from non-problem gamblers, what I was just trying to frame there in my critique is that the way that this was framed misconstrues what I believe to be a more fair perspective on the issue. And so it's not that I disagree that harms don't affect family members or significant others. That's not the case.
Okay, I'm going to change topic now and start asking some questions about what might be an appropriate evidentiary basis for taking regulatory measures.
Well, before you do that, have you got an idea of how much longer you might be?
Commissioner, I would estimate 15 minutes.
I think we might take another break. So we'll take another 20-minute break. So that'll mean we'll be coming back at 10 minutes to the hour.
All rise.
Please be seated. Thank you, Dr. Fernando. Thank you, Professor Rockloff. Mr. Lee.
Dr. Philander, just before we broke, I was about to take you some questions about evidentiary basis for potential interventions. And we were at 3.2.3, which we've got up on the screen. And you can see the final part of the last sentence. You say the empirical findings are inappropriate for policy settings. And again, that's going back to the Brown et al. Paper from 2016. What do you mean by that?
By that I mean that the conclusions that Professor Rockloff comes to in his report to the Commission around the disproportionate impact of harms coming from non-problem gamblers, as well as sort of the net impact discussion. I don't think that those empirical results should be considered as part of a policy decision because there's too much uncertainty around those actually reflecting what we truly want them to reflect.
So in that case, what sort of empirical results or empirical evidence would you say is appropriate for the use in determining a policy intervention of some kind?
I mean, I don't know. It would depend on the context of the particular policy decision.
So in the context that we're discussing now, being a question of perhaps introducing limitations or restrictions for the purpose of trying to achieve a reduction in gaming-related harm, what level or quality or certainty of evidence do you think is appropriate before a consideration is made to introduce one of those limitations or restrictions?
Well, I don't think it's something that you could identify in such a precise binary way. What I do think is a better framework for thinking about that idea that you raised, which I think is actually an important question to ask, and thank you for bringing it up. What I think is the force with which you regulate should be proportional to the extent that there's evidence supporting that decision. And so in areas where we have a strong basis of evidence that something it can be quite effective, like self-exclusion, I think it's reasonable to say from a regulatory standpoint, every property should have a self-exclusion program. What's less clear is, what does that self-exclusion program look like? And that's where I think you want to be open-minded around what's the right context for creating the regulatory approach to that particular tactical strategy.
Okay. Is the corollary or the extrapolation of what you've just told us that until such time as the evidence to your mind is clearer in relation to harms being experienced by non-problem gamblers, it would not be appropriate to have any limitation or restriction that was directed towards non-problem gamblers?
What I'm saying is that there's lots of good ideas, there's lots of bad ideas. We don't really know which are which at this stage. Certainly, there's not been a lot of research on the responsible gambling side, and by responsible gambling I mean gaming operations management as opposed to problem gambling, which is a separate but related field. And so, with that in mind, we just don't know what the outcomes are for a lot of strong regulatory decisions. And so, what I think has been articulated in this report, others, are plenty of good ideas. But what I think you need to do is approach those interventions from a thoughtful perspective where, this might be something that we're going to explore, that we're going to set up a research program around testing to see if this makes sense, but not necessarily something that you want to codify and provide very strict rules around the way that it must be employed. I think that can be a mistake, and that's a mistake that jurisdictions have made around responsible gambling interventions in the past.
Okay, so if I understand you correctly, you generally indicate that none of the matters which have been referred to by Professor Rocklov on matters that you consider have yet reached the requisite level of evidentiary support for it to be appropriate that they be introduced. Is that a fair summary?
I think I articulated my views on each of the interventions with which I took exception in the report.
Yes. Do you consider that there are any interventions, not necessarily limited to what Professor Rockcliffe has talked about, any interventions that are directed towards limitations or restrictions aimed at non-problem gamblers that currently have a sufficient level of evidentiary support that it would be appropriate to introduce them?
So, I mean, your question is, if I understand this right, are there particular, management strategies that can be employed that would reduce gambling harms, despite the fact that they're not directed at people who have already reached sort of a clinical level of gambling problems? Is that correct? Yeah, no, I think there are. I think there's a lot of strategies that that do make sense from that perspective.
And without trying to be exhausted about it, could you assist the Commission by giving us a sense of what you have in mind?
Yeah. So, I mean, one of the strategies that that we've used in British Columbia is really around adopting a model of educating consumers. And so one of the programs that we developed was an advisor program who would basically make strong relationships with regular customers. And so by doing that, it was sort of not a therapeutic relationship, but it was a relationship built upon trust. And it was also a resource for staff in the venue. So by having somebody who's an on-site expert in responsible gambling and then has some knowledge about the sort of clinical counseling world, they can be an interface for employees, but also build relationships with customers. There's a lot of like subtlety in the service management strategies around that. But I think that's an approach which has shown some merit.
So that educational approach, that's directed towards making sure that the consumer is ultimately fully informed about their gambling risks. Is that correct?
It's about, that's part of it, certainly. I mean, one is like about gambling risks. The other is about how to play the games. The third is, where are their support resources if you need them? I mean, ultimately, it's also about just building a relationship with the customer so that if they ever have any questions or needs around these issues, that they have somebody with whom they've created a relationship that they can approach.
Is there any aspect of that program which is regulatory or limiting, such that it prevents people from doing something they otherwise might do? Or is it purely focused on the idea of educating and empowering?
So the regulatory aspect of it is that casino service providers, who are effectively casino operators, are required to have one of these people and space for them on the casino floor or near the casino floor.
Thank you. I'll just take you now to page 7 and 8 side by side, please, and we'll look at paragraph 3.2.4.
Can I add one thing to that? Would you mind? I just want to sort of qualify this by saying I wasn't asked to provide an overall perspective on what a good responsible gambling program would look like. And so I just tried to provide an example to answer your question directly.
Yes, thank you. So just looking at this paragraph, and it's obviously a continuation from the paragraph we looked at a moment ago, and you then note that there's essentially an ongoing debate in the literature, and you say in your final sentence that this ongoing debate further underwrites the notion that none of the empirical findings or methodologies are appropriate to be used in the policy setting at this time. My question is, in relation to debate in the space, in the gambling harm space, would you agree that there's an awful lot of debate and that most things are contested?
No, I mean, I don't know if that's a fair characterization of it. I think there's a lot of agreement as well. So I wouldn't say that most things are contested, but certainly the things that make their way into academic studies, and like this back and forth that exists in some of these journals, those will obviously be the contested things.
Yes.
Yeah, I mean, I think many of the symptoms of gambling harm, or the measures of gambling harms, I think there's agreement on that, even though there's disagreement on some of them. Yeah, so I don't know if I would characterize it the exact way that you described it.
Let me try and narrow my question so as to be more precise. If we're looking at questions of potential interventions, which would function by limiting or restricting the access of non-problem gamers to gambling games, in that space, would you agree that there is significant debate and that there are no measures which are universally agreed upon as appropriate?
I mean, I'm not sure that there's enough coverage of that to even comment about what the state of the literature is. But I think if you ask me to sort of speculate on the sentiment held by various researchers,
Sorry, I should just jump.
I would say
I should jump in
yeah.
and say I'm obviously phrasing my question badly. What I'm trying to
Okay.
ask is, you've said, in essence, there's a debate going on, and that's another factor why we shouldn't lead to adopting some of these measures now. My question is, in terms of your approach or your viewpoint, what level of debate in relation to a potential intervention do you see as disqualifying the introduction of a potential intervention? So I'm more focused on your opinion.
Oh, yeah, no, so I think you're conflating two ideas here. This piece is in response to the actual discussion around measurement of harms. And then I think what you're then conflating that with is the evidence base for specific tactical responsible gambling interventions, which I think is a different question.
All right, let's move then clearly to the second question about the evidence-based tactical responses. And if I didn't make my question clear before, in relation to those potential tactical responses, are there any that you can think of where you would say that the evidence is in and it's a good idea to have one of those tactical responses?
Self-exclusion programs.
Okay, so that's one where a person themselves chooses to self-exclude, is that correct?
Yes.
I'm asking in relation to a restriction or limit that is imposed upon the gambler by the gambling operator, whether they want it or not, such as
I see.
Pre-commitment, charging entry fees into casinos, the various sorts of things that were set out in Dr. Rockloff's report. Do you consider that there are any tactical opportunities or strategies which are properly supported by evidence?
In this response, I was responding to very specific things that were outlined by Dr. Rockloff. So let me just qualify what I say by that. I think some of these ideas are, it's hard to tell where some of these interventions start and the others end. So take, for example, restrictions on the amount spent. I think there's a growing body of evidence that suggests that providing normative feedback about what a typical person would spend when people either start gambling or if they were to set a limit. I think the context of this is mostly online sites. I think there's some evidence that suggests that helps people moderate their behavior towards more normative levels. That's not something which I think, as you're describing it, is like a sort of a top-down, hard-line intervention.
So thinking about some of those, as you described them, hard interventions. You spoke earlier, I think you were being questioned by Mr. Dharmananda, and you were talking about the possibility of mandatory pre-commitment, and you said essentially, paraphrasing you, that it wasn't clear as to whether it was a good idea or a bad idea, and the evidence was reasonably scant. Is that about right?
Yeah, I mean, just to share my own experiences in in looking at these programs, the challenge that I had was working with a lot of these gaming equipment manufacturers who provide all of the gaming management systems for casino operators. They're the ones who provide and control all of the software that would go into a property like this. And because of the nature of their business operations, they operate on such long cycles of development, even when you're working with them quite closely to try to optimize, a specific budgeting system. That the constraints around building a play management system or a pre-commitment system in a way that effectively iterates on the consumer experience. You might think about like how quickly you get updates on your iPhone about an app that needs to be updated because they've just A/B tested a whole bunch of things and they figured out a more efficient way to do it. That's just not possible with the way that gaming equipment exists today. And so, what I just wanted to express was, I don't know if these systems will be good or not, and the epoch that it will take in order to come to the right version of that, because there's probably some version of voluntary or mandatory pre-commitment that at least helps some people some of the time. That's probably a net benefit. But to get to that version, it's just something that's going to take a lot of time. And so, sorry, go ahead.
No, I was just saying, in terms of the time it would take to get there, would you agree that one of the problems right now is that there is not a market for casino operators, for example, demanding that software, and so there's no impetus to try and develop it?
Yeah, the biggest challenge with responsible gambling innovation, I think, is that there's on a global scale, there's no sort of shadow price for responsible gambling. So that there's no strong incentive set in order to innovate on this frontier.
Well, bring this into concrete terms. You may be aware that another Royal Commission in Victoria has recently recommended that there be mandatory pre-commitment on their electronic gaming machines at the Crown Melbourne Casino. Were you aware of that?
No.
Whether that recommendation gets picked up or not, we don't know. But if the government did pick up that recommendation and mandate it, with the requirement that the casino then introduce that technology, would you agree that that would create a market for it and an incentive for programs to be developed, and that therefore programs would get better?
I don't know, maybe. So it's the challenge with creating a market, right? And you can think about this in the context of responsible gambling programs, is that when you create a regulation that provides like a very specific milestone. So by milestone, it's like the launch of a certain software program or whatever that might be. That's just an RFP that probably request for proposal that goes out to a specific gaming manufacturer or a small set of them, but doesn't actually force anyone to innovate. They just have to meet those compliance terms. What I'm talking about with the shadow price is what ongoing incentive structure encourages people to continue to invest in responsible gambling. So, something like, here's like an absurd example, but let's suppose that casino operators received a 10% discount on the tax that they had to pay for, every 20% reduction in problem gamblers in the jurisdiction, right? So that's an incentive structure where, all the parties are aligned towards the same goal, and it continues to feed innovation. That's kind of that's a little bit of an absurd example, but that's the framework that I'm talking about when I talk about how do you create a market for responsible gambling.
Thank you, Dr. Philander. I might move on to a different example, so away from the mandatory pre-commitment, and just use one of the other examples that was in Professor Rockloff's paper, which was the discussion about the EGM jackpot expiry option. Mm-hmm. And you discussed that and you pointed out that the proposal was based on a lab study of only 130 participants, and that as a result, the quality of the data wasn't perhaps what you would consider to be sufficient. Have I summarised that fairly?
Yeah, I'd say that's probably correct.
So would you agree that there's a bit of a chicken and egg problem here, in the sense that researchers can do experiments like what Professor Rockloff did, but until it's actually tried in a casino, you won't be able to find data to validate that assumption, and that it's unlikely that casino operators will want to volunteer for that if they consider that it might reduce their revenues?
So I do think that there's a chicken and egg problem in some respects, but what I'll say is that there's different levels of evidence that can build towards a stronger policy perspective. And I think I'll give you a particular example, which is the artificial near miss. And so, that's an idea. And has this been spoken about in the commission hearings at all, or it would be helpful for me to just talk about what it is?
It might be useful to briefly articulate it.
Okay. Yeah. So the idea of the artificial near miss is so a near miss is a slot machine that, let's say in a normal 3-reel slot machine, where you would get 2 correct reels, and then the third reel almost lands on that. So it would be a cherry, and then an almost cherry, so that you've nearly won, and it increases the anticipation and increases the salience of the event. There's been evidence that is built towards the idea that artificially increasing those near misses, which in some jurisdictions, I don't think this is the case in Australia at all, but in some jurisdictions, these appear higher than they would randomly occur, given what the appearance of the consumer is from the reel. There's been evidence that has shown that is related to excessive risk-taking and an increased likelihood of people developing a higher level of risk when they engage in machines that have, that sort of design. And the evidence base in that has been something that's sort of built over time in lab studies, but now has eventually made its way into policy decisions. And so you can think about, like how, and I don't know the whole history of how it developed, but you can think about how that something like that might develop, where you start with, like a small study like Dr. Rockloff's study, which is a good study, good academic study, something worth exploring. And then if that shows evidence, then you might do it with a larger sample. And if that shows evidence, you might do it in a different jurisdiction with a different type of sample. And if that shows evidence, then you might do an fMRI study where you're actually looking at the brain to see if that's something that aligns with what we know about the way that brains work when people have gambling disorders. And then, as that evidence starts to build, then we start to think, okay, well, maybe this is something that we should look at on the casino floor. To the extent that I can go back to your question, I think that there, should be more opportunities for researchers collaborating with operators for things that might warrant it.
And on that front, in terms of the collaboration, obviously that would depend on whether an operator was willing to volunteer for such collaboration.
Indeed.
I just want to ask a very narrow set of questions in relation to this issue of industry funding that's being debated today. I do not want to speak about any particular person or any particular body in relation to industry funding. I just have some general questions for you in relation to that issue. As a basal point, do you consider that it is possible for a researcher who receives funding from gambling industry sources to be unconsciously influenced in the way that they either approach the selection of research topics or the way that they conduct their topic?
Yes.
And in relation to that point, you mention in your report that, I think it's 9.1.2, but I won't take you there. You say all academics face a set of conflicts of interest, and that to focus solely on industry funding is deceptive and incomplete. What conflicts of interest do you have in mind when you are looking outside of the gambling industry space? Are you suggesting that states or university funding may carry with it a conflict of interest?
No. I mean, I wasn't talking specifically about grant funding. the there's the it's getting a little late here. Sorry, sorry if this also doesn't come out so smoothly. So all academics are incentivized and rewarded based on the impact of their work, and the impact of their work is accelerated by grant funding in many cases, but it's also impacted by the degree to which the media covers your work. It's like the extent to which you have international collaborators, many different things that all roll up to the incentive structure that academics have, which ultimately determines their ability to do things like gain tenure or get raises on an annual basis. And so I think that was sort of the broader point that I was trying to make.
All right. And if I understood you correctly, at one stage you mentioned that this area of research is in its relative infancy and it hasn't yet progressed to the area or to the stage where there is readily available funding from governments and from regulators and so on. Did I understand that correctly?
So certainly, if I speak about gambling as a field broadly, a disproportionate amount of researchers are in the United States, just because there's so many universities in the United States. So I don't want to speak specifically about the Australian circumstances, because that's not something with which I'm eminently familiar. But just to the extent that the U.S. perspective reflects sort of the global perspective of the gambling researcher field, because it is a large part of it. The funding model for gambling research, gambling addiction, is certainly not nearly as developed as that for alcohol and drugs.
And my question is, in your opinion, would it be preferable if that was the case? Would it be better if it was able to be the case that we funded all gambling research without recourse to industry funds?
I think there's certain areas of research which lend themselves better to government funding, and certain that lend themselves better to industry funding. So when I think about some of the things that are better funded just sort of generally by government, that's the sort of primary research, like this base knowledge about gambling that really doesn't have an end goal in mind. That's really just sort of about understanding gambling and behavior and people. I think that's research that's always going to be really hard to get funded. But I think that there is research that should be funded by industry, because it's something that's so applied and practical to industry. So if you want to study how do you actually create the best possible self-exclusion program, I think it's fine if that's funded either entirely or partially by the gambling industry, because they're the ones who are going to have to be eminently involved in it in order to facilitate that research. And so it makes sense, because they're going to have to play a role in some way, shape, or form, that they do have skin in the game in that way.
Thank you, Dr. Philander. Thank you, Commissioners.
Thank you, Mr. Lee. Now, we move to the next stage of this process, which we wish to give you the opportunity to explore issues with one another, with probably minimal intervention from this room. Now, the way I think this will work best is if you take it in turns. If one asks a question or poses a question, you debate that question, and then moving to another topic with the second person asking the question. And it would help me if at the start you would identify in very short form what the subject matter is. Now, before we go into that, do you feel ready to move straight into that, or would you like 5 minutes to get your thoughts in order as to what you think might be the most valuable things to discuss with one another? Jot them down, or are you ready to move straight into this process? Dr. Philander?
I mean, I'm just burning daylight here, so I prefer to just keep moving. But I don't know that I have many items to discuss in either case. So happy to move.
Are you happy to proceed?
Yeah, I'm happy to proceed.
All right. Well, Dr. Philander, would you like to pose to select the first subject and identify what it is, and then the two of you can entertain a discussion about that issue?
Yeah, I mean, I think we've probably discussed fairly well, the extent to which our opinions overlap or don't overlap. And so, Dr. Rockleff, if you have anything front of mind that you want to bring up first, I'll let things marinate. But
Yeah, I mean, I'm glitching. Sorry, I glitched there for a second. Look, I kind of feel the same. I think we could probably both of us feel a bit talked out at this moment. But I guess at the risk of going over the same territory that we've gone over before, I think it would be interesting to hear from you what you think the evidence base is, or the future is for creating these interventions. And I guess I'll be more specific. I remember in your critique, you talked about my research on jackpot expiry, for instance, which I'll admit is something I completely invented in the bathtub at one point, and then did a study on it that demonstrated that basically people gambling for real money, albeit in a simulation experiment, had lower spend as a result of having jackpots expire. They would basically use that as a cue to quit early and walk away with more money. So that was the sort of basic result. In your critique, you said that this could have unintended consequences. And I think that's a lot of maybe emblematic of a lot of what I saw in the critique is, oh, this could have unintended consequences. But I thought in this particular circumstance, it was salient to me. I was thinking, well, what unintended consequences? Like what would be bad about that? How would that affect, other than potentially, having a gambler walk away and the casino's earning a little bit less money that day, which definitely is a possibility, and in fact is the point, right? It gives people an opportunity to consider whether they want to keep gambling, which they can freely choose to keep gambling if they want to, but they're not going to win a jackpot. So what would be your imagination of what the unintended consequence of introducing that scheme into? What could go wrong? What could go horribly wrong and make everything a giant disaster as a result of that? I'm being hyperbole, but if you could think of anything that would go wrong with that scheme, I would be interested to hear it.
yeah, I mean, so part of the challenge with I'll give you a couple examples, but part of the challenge with unintended consequences is that they're unintended. So it's it's always hard to see what happens before. But just a couple of ideas. So one is you're creating a salient framing point for the gambler around a very particular level of volume. And so that might distort somebody's perspective on what a normative amount of gambling is. And that might, for somebody who's going to spend less, that focus them on that point. And so people might end up spending more in that circumstance. The other piece is that some people might spend over that amount. And sort of, here's where the devil's in the details of how you implement this, because a lot of this comes in the very very specific user interface, user experience details. But let's suppose somebody goes beyond that level, and all of a sudden now they realize that they are not eligible for the jackpot, and now they experience distress and they get upset for what's a very marginal amount over that limit. And so like I said, it might be a good idea, but I think there's some nuance to all these sorts of things, and we don't know what's going to be unintended. I think, while you were talking, I was able to think a little bit more about the level of evidence that I think makes sense. And I think part of it is, this isn't a complete thought, but part of it is this idea of academic theories. And so, when we talk about theory, that's different than a hypothesis. A theory is something that truly explains the nature of some natural phenomena. And so, the prototypical example of this is the theory of natural selection, where we can explain a whole lot about the way that nature exists because of the way that people will, or the way that different things will self-select into replicating, and whatever survived was the thing that was, most adapted to survive. So that's a great theory. It explains a lot about why the world is the way it is. And so these types of theories also exist in other realms of academia, where ideas start with a hypothesis, and so that hypothesis might be made based on qualitative evidence or some sort of intuition of the researcher. But as we start to accumulate more evidence, both empirical evidence and better models that help explain that empirical evidence, we might truly build up into a type of theory that actually explains, in this case, perhaps consumer behavior or gambler behavior. And so, you might think that if we take all the evidence around self-exclusion program, that we could eventually roll up and explain some sort of model around, or some sort of theory around why self-exclusion programs work and make sense. Because, you have something like a very motivated player. You have an intervention that occurs when they're going to be in a hot state on the casino floor. You have the right support programs that make sure that somebody, once they're excluded, that they're not getting any more marketing material, or maybe they can't go to any other gambling venue alternatives in their area. And then we can add that to the empirical evidence that we've seen around these things that help explain that when somebody goes into this program, that all of those models of how we think that people relate to these self-exclusion programs in their environment, that all of that makes sense when we actually look at the numbers. And so when we think about the body of evidence, that's perhaps a way of thinking about it. This is somewhat incomplete thought. I don't know, Dr. Rockcliffe, if you have any ideas, or if that sort of jives with your thinking as well.
Well, I guess my impression of that answer is consistent with my concern around the general approach, which is saying, well, we have a good idea, maybe, let's say, jackpot expiry, but what we don't have is comprehensive theory to explain jackpot expiry. And so what we need to do is put people under a fMRI machine and see how jackpot expiry affects their brains. By the way, in that study, we did measure whether people enjoyed the experience after they quit from their jackpot expiring, and people who went on, and there was no difference between the two. So that that was incorporated into it. Nobody was terribly upset by the experience of their jackpot expiring, at least so far as they self-reported. But to the fixable thing of having people gambling up to jackpot expiry is also fixable in the sense that you can have a indeterminate time at which the jackpots expire, so that people can't anticipate when those jackpots expire. That aside, the issue of having a comprehensive theory and 20 studies on jackpot expiry, I'm just wondering, when is it a point at which you stop and you say, I should try this in a real environment, where, again, as we've been discussing, industry will never have an incentive unless you create the incentive. And you talked about creating incentives, which I think is generally good, because I think the idea here behind that idea of the shadow price of creating an incentive for industry to quote unquote do the right thing, which is kind of sorely lacking in the system. How can you articulate when enough is enough and you should actually try this in the real world. Again, with the real world being either creating a brand new incentive for the industry, which they probably won't want to have, or forcing the industry to cooperate with researchers. When is that? We talked about 20 years, and different things around that. When do you think enough is enough and we should actually try something in the field? And can you articulate that I know it's hard to do in reference to any intervention, but can you articulate that with respect to jackpot expiry, for instance, or pre-commitment? When is it that we should try this? I'll tell you right now, I don't feel like we'll ever know anything about pre-commitment until we actually try it in the field. Like, the theory's there in terms of the psychology of it. The question is how do we know it works unless somebody actually tries it? So do you have any reflections on that?
Yeah, I mean, so I think a good model for thinking about that is the National Science Foundation model, where you would have a set of individuals that understand the field and can make a judgment around a particular study that might have a sufficient evidence base to warrant further exploration. Now, it's not obvious to me in this circumstance that like the National Science Foundation is it's a body of basically all academics in some way, shape, or form who would fund research in response to grant proposals that they receive. And it's a fairly rigorous process where the person applying for the grant has to demonstrate that they're a researcher who's actually capable of doing the research, that they can manage that grant, and that there's a sufficient evidence base to warrant whatever this next iteration that they're proposing. And if that goes well, that the outcomes from seeing that study through warrant the investment in it. And so I think that's perhaps the type of model. I don't know if it's if the committee needs to be all academics. I don't know that necessarily makes sense. But I think if we're just thinking about frameworks that you might overlay onto a certain decision criteria, I think something like that makes sense, where you have people that understand the field, understand the state of the literature, and can make a judgment about a particular study and a particular principal investigator's ability to execute on that study.
And who's going to do that? Who's going to create that scheme? Like you mentioned before that in the United States, for instance, which I think is a terrible shame, there's no gambling research from, for instance, or very little from the national science bodies, and in fact the only source or one of the very few sources of funding for research is from the gambling industry. And so would you imagine that the gambling industry would put together that sort of proposal?
Well, in some respects in the United States, there are, the International Center for Responsible Gambling, which used to be the National Center for Responsible Gambling, has a model that looks somewhat like that. So the Scientific Advisory Board, which is actually all academics, it was largely modeled on that National Science Foundation idea, as far as I know. And so that is a case where that's happened. It's not obvious to me, what the right framework for that is in the context that we're exploring here. I mean, you just asked me a question of, what type of model would make sense. I described what I think would make sense, but I don't have a magic wand to make the world as I see fit. So I'm not sure if that's a fair question to ask to me, but I think that's the type of model which would lead to the best outcomes over a long period of time.
Okay, thanks. you have any questions for me?
Yeah, I mean, I guess my one question for you, and I think you talked about this a little bit. I would just like you to perhaps discuss a bit the idea of the measurement of harm as you've chosen to do it in this report versus something like a health impact assessment. And by that, I mean, is it not reasonable to just measure health impacts directly? Why do we need to necessarily roll them up to some summative score that we try to add together, which I don't feel necessarily adds together? Like instead of saying a bankruptcy is an 8 and a domestic violence issue is a 5, and then we roll that up and it's a 13. Why can't we just count those issues and weigh those or consider those directly? Because I feel like we're adding up things that don't necessarily add up, and so we still have to use some level of subjective judgment to understand the decision making that we're making anyway.
Yeah, I think we don't do that, by the way. We don't add up things differently. In fact, we find that harms are a unitary construct in that we just add up all the harms, irrespective of whether they're very serious harms or not so serious harms. And because they're unless you give the entire set of 72, which is not really realistic, you don't actually have to ask people of every single harm, because low-level harms are actually indicative of the fact that people will be more likely to suffer high-level harm. So we don't make judgments about which harm is more harmful, but one could do that, I suppose, in a sense, and we've shown that subjectively more, you can group harms into more serious harms that people generally agree to be more serious or whatnot. So. Sorry, I kind of lost my train of thought. What was the question again?
Just your perspective on the health impact assessment model and whether or not you think that's appropriate.
So I wouldn't. So particularly the Tasmanian research, that's not something I want to say, hey, this is the correct answer. There's 0 harms in Tasmania, or -2% per person in Tasmania, and that's the absolute answer. As I was noting before, I think it's valuable to move in that direction of trying to understand what the summative harms are, and the reason why it's valuable is it is very much in its infancy. But the reason why it's valuable is the alternative of those social impact assessment sort of exercises, which again I think are great. I particularly like Williams' one that's in Alberta and is being redone in Massachusetts. It's very comprehensive, and he talks specifically about, I can't remember which parts they are, but he's talked specifically about things within there that you should not quantify. That is, you should not put a number on. That it should be a more subjective judgment, and I think that again, not remembering the details of it, that he made a pretty persuasive argument that there are things in there that are not really appropriate to quantify in terms of understanding those social impacts. So my point is not to say, hey, let's have either or. Let's just try and put one number to it, or do these complex social impact assessments. Social impact assessments are really great from the standpoint is you understand multiple perspectives, economic perspectives, social, employment, all kinds of things that will affect the population for new gambling opportunities, for instance, when a casino comes to town, that sort of thing. And this is very appropriate to do. The downside of that is that people, with those complex assessments, people walk away with whatever answer that they want to take away from it, because there's good stuff and there's bad stuff. There's no weighing of the overall impact as much as there's a bunch of good stuff, there's a bunch of bad stuff, oh, we have to consider this. And two people can look at the same social impact report and come up with very different conclusions as to whether this new casino, for instance, is a good idea or not. And that will often be based on motivated reasoning. So they'll say, I think, I generally like the casino industry. I think it's great for jobs or great for industry. I notice that social impact assessment says all of that. It says it's going to be great for industry. It's going to be great for jobs. Hey, we have a lot of people, out of work. And then they'll discount the parts of the social harms and the problem gambling that's also in the report. And then people on the other side who are really concerned about, gambling problems are going to do exactly the opposite. They're going to take that stuff that says, oh, there's going to be all kinds of gambling problems in here. People are going to be robbing each other. It's going to be horrible. It says so in this social impact report. And they're going to run with that, and they're going to kind of discount and or gloss over the economic benefits. So my argument would be, why not both? Why can't we have everything? Why can't we keep trying these techniques where we actually look at the overall impact on whether people are getting good value for money? And I think that's one of the principal things of the Tasmanian study that pointed out. And in fact, somebody, I won't name names mainly because I can't remember who they are, but there was somebody from the gambling industry who was kind of a data analyst that came up to me after listening to a presentation on that Tasmanian study and was arguing, points about, well, maybe I was wrong here about how much I, calculated here or there. And I had a conversation where I said to him, hey, one of the principal things here is that gambling is horrible value. Like, it's for value for money. It's bad. Like, you don't get enough enjoyment for the amount that is being spent on it. And he said, actually, I completely agree with that conclusion. The problem is that you're not getting enough for the consumer out of all the problems that it's creating to justify, what it is. So it's not priced well, in other words. You wouldn't know that if you didn't have this kind of work that I'm doing. And that's why it's important to have those kind of metrics, because you can actually track it over time and you can say, hey, the value is increasing. More people are getting benefits, fewer people are getting harms. And here is a number that shows that we're improving, we're creating greater consumer welfare over time. Social impact assessment is not going to do that. It's not going to be a metric that's going to allow you to come up with that kind of conclusion.
So when I was talking about health impact assessments, it's I think it's perhaps slightly different than what you had in mind. It's more of a collaborative, iterative process. And so it's not just about measurement of specific social outcomes, but it's about, it's a collaborative process involving all of the stakeholders to health on a particular project or policy intervention. So it's a process designed around stakeholder engagement and allowing all of those groups to identify relevant health-related outcomes, be they good or bad. And then a process around engaging the likely outcomes of each of those with a project, both before it happens, but then also following the actual impacts overall later. And so in that way, it's a process that can pull in, I think, more specific harm measurement tactics, as they're relevant, but it's more of a guiding model for understanding how we're going to approach, from a jurisdiction-wide perspective, engaging in health-related issues in a collaborative way that involves all of the key stakeholders.
Yeah, look, I guess I'm not familiar with that approach in particular. I think one of the problems I have with the overall framing of it, though, is I think it presumes an incentive on the part of some parties that is not there. The gambling industry is a for-profit enterprise that uses its money like any industry, and this is not a moral judgment. It's just reality. The big boy reality is that they're in business to make money, and the presumption that they would be interested in a serious intervention that would have the possibility and the probability, if it's actually effective, of reducing individual expenditure. Now, there is a long-term goal within the industry that might be aligned with good practice in that you can't stay in business if you cause enough harms to destroy the industry. But I don't see that they have a great incentive to create a great program that would actually reduce their revenues over time. And so I guess I'm suspicious of that part of the model, saying, oh, it all sounds nice that we should be all collaborative, but if the incentives have to be there in order for a collaboration to produce a good result.
Yeah, I suppose I think that's where like a large part of our differences lie, in that I think perhaps you're more skeptical of certain actors' behavior and are more in favor of specific interventions on like a tighter timeline. And I think
or any intervention. I said, or any intervention would be fine too. Not specific interventions, but anything that you might propose. I would say, yeah, let's try that.
Yeah, understood. And I think my perspective is one of what's the right approach to building a system? What's the right approach to putting in a specific model that might lead to a sustained improvement of outcomes over time. And so that would be, I think, what I'm more in favor of is how do you create the right programs, the right incentives in order to ensure that, you could walk away from all of this for 10 years and come back and a lot of progress has been made. And, good progress. And so I think that's sort of the framing by which I see a lot of these issues.
Yeah, and I understand that. I think, I think it's easy, particularly when you deal with people who are in industry, and particularly on the side that you were in, right, on consumer protection, stuff like that, of knowing that these are good people, like they really want to help, they want to do the right thing. They, you find that from a lot of people who work in the gambling industry. It's not a moral judgment that I'm certainly making, but I think we do differ in our maybe belief about institutional culture, and whether people can overcome their own obvious self-interests in terms of the profit of their organization, the success of their organization, to make decisions that are not in the best short-term interests of the quarterly profit of the institution that they're in. Now, I don't know what your belief is, but my belief is that people really, even being good people, have a very, very hard time doing that. And I think you're right that I'm suspicious, and maybe you're less suspicious, given your experience in those venues and speaking to those good people who are trying to do the right thing. That we just have a different opinion about how organizations work, and I don't know if that's resolvable in this session.
Yeah, and I don't know that my views are necessarily characterized by the people with whom I interact, but I think that I am more in favor. I think at one point they're trying to characterize me as being anti-regulation, which I'm not. But I think a good approach to regulation is to put processes in place, and I think that's where I think the right approach lies is changing processes, not necessarily mandating compliance.
I think we've got.
I'll leave it there.
I think we've got a good idea of your views on that particular issue. Are there any other questions you'd like to pose to one another?
Well, I'm sure we could talk forever, but you probably wouldn't want that. So,
We've been talking since May, and you said you're talked out, so are we.
I bet.
Dr. Philanders, anything else you'd like to raise with Professor Rockloff?
No, nothing else. Thank you.
All right, thank you very much. Now, I haven't ignored other people in the room, but as I understand the process, other interested parties were invited to ask if they wished to cross-examine, and they indicated they didn't, so I'm working on that assumption.
Commissioner, not in this session. We did have a couple of questions from Professor Rockloff right at the end in the miscellaneous section.
All right, but nothing for the concurrent session. All right. Then what we'll do now, I'll give each council an opportunity to re-examine you, and when council has completed the questions that they want to ask, they'll give you an opportunity to make any closing statement. So if you wanted to summarise your opinions or say anything at all to us, that'll be the opportunity to do so. We'll start with Mr. Lee.
Level 1 request to ask questions before re-examination.
Oh, you want to do that now? You want to? Yeah. Sorry.
12.
We've got there may be a couple of questions from. You want to? Okay.
So I understand that was that the way that the parties understood the protocol, was that commissioners were to ask questions before re-examination?
I understood it as giving you carte blanche to ask whenever you wanted to ask.
That's excellent.
Well, perhaps in fairness to you, Mr. And Council Assisting, I should ask some questions now. My first question is to Professor Rockloff. Hopefully a fairly simple one, is when you talk about gambling related harm, is that the same as talking about gambling caused harm or something else, or not?
Yeah, gambling caused harm. Harm caused as a result of the person's gambling, correct.
Thank you. Dr. Philander, next, in respect of you, you spoke about what I will call your hybrid informed choice model, including an element or a requirement that a patron does not have false beliefs about the risks of gambling. And you spoke about gambler education to inform a gambler about the risks of gambling, and also, I suppose, would that include also to dispel false beliefs about gambling, about the risks of gambling?
Yeah, that's right. So I think the best way to frame that is that people are making rational decisions about when to gamble and how much to gamble.
And my question is have there been studies which have attempted to ascertain the level of false beliefs about the risks of gambling in respect of what we would call electronic gaming machines or slot machine gambling?
Yeah, so that literature would be typically referred to as cognitive distortions. These are irrational beliefs about gambling that might be something like you believe that there's an element of skill to a slot machine that's entirely random.
And
those studies have been done.
What do those studies show about the extent of those false beliefs?
I don't.
Sorry.
Yeah.
Focus.
Sorry. Pardon me. I'm not sure about. I think what you're asking is like a prevalence question. So like the extent to which electronic gaming machine players have those, and I can't provide an answer to that. But I can say that those are very important to the development of gambling problems, and dispelling those are an important part of gambling treatment programs.
Thank you. So I'll go, Professor Rockloff has indicated that he has a comment to make about that question.
Yeah, So what is consistently found is that non-problem gamblers have a good number of cognitive distortions. So recreational gamblers, all the way down to non-harm problem gamblers are filled with distortions about how they gamble. They misunderstand how the machines work. I don't know if you've ever played the machine, but you can solve this very easily by just playing the machine once and trying to figure out how it works. Good luck. Go to the second screen that explains how it works. Good luck. Because it's seemingly complicated. It's actually not very complicated, but the complication is part of the fun. So what you do is it behaves in all kinds of crazy ways, and the all kinds of crazy ways is what makes it so attractive. And we often find gamblers, both regular gamblers and gamblers with problems, will say to us, oh, I really love this machine and I played it for months and months, and then I got bored with it because I figured out how it works. And then they'll go on to another machine that has this apparent complexity that's different, like what combination of symbols give you the best winning outcome, or what produces the special feature. It's all very complex, but of course behind the scenes, it's just a pay table that essentially works kind of like a lottery every time you push the button, and pays off based on whether the lottery is a winning lottery or losing lottery. So it's really apparent complexity without being actual complexity. And for that reason, people create all sorts of ideas about strategy and how they might, how the machines might pay off. Like there's the gambler's fallacy, where where you have a streak of wins, and whether that's going to produce another winning outcome because of the past history of the machine. People often don't want to walk away from a machine that hasn't paid out for a long time because they think it's due to pay out. This is not how the machines work. Every single spin is independent, so it doesn't matter if it's had a very long streak of not paying out. It can have another very long streak of not paying out. But people persistently don't understand that. Now, I'm not saying that in a moralistic sense of, oh, these games are horrible, blah, blah, blah. I'm just saying that that's part of the fun of how they work, but it is also part of the fact that people don't understand. And I don't have any strong belief that you can educate people without putting them through a 3-month course on probability statistics, actually to teach them how to use it.
Can I stop you there, Professor Rockloff? Because that was what I was going to go back to Dr. Philander about. Because, okay. Dr. Philander, I understand that in your model you say that it is possible to educate people to dispel those false beliefs and to ensure that they understand the risks of gambling. And in respect of EGM use in particular, I wanted to know, what do you say an RSG program in a casino should include to ensure that those EGM, or what we call electronic gaming machine users, have that education?
So that's that would require a long response. So I'll say this much first, and then ask me if you'd like more detail. So the first part that I was articulating was that a lot of people have gambling problems. So actual gambling disorders, they develop as a function of these cognitive distortions. As Dr. Rockloff identified, a lot of people who don't develop problems also have cognitive distortions, and in some ways, that's part of the experience. But dispelling those when they become sufficiently burdensome that they distort people's actual decision making around their likelihood of winning or losing, that becomes relevant at that sort of clinical level, where people hold these strong beliefs that they're likely to win, or that they can control outcomes that they truly cannot control. In the context of how you would want to create a responsible gambling program, I think there's a lot of different sort of tactical service management strategies that are important and that sort of work together. So, I mean, if you look at what the best practices are now, it's things like signage, it's things like when a gambler expresses a false belief, that employees dispel that belief and are trained to do that. It's things like the responsible gambling expert on site that I described previously. It's having available information for people who actually want to know how the games work and learn how they work, both so that people can seek out that information, but that it's also pushed out to players through the right mediums, be that through the machines or be that through email marketing or just available pamphlets or information at different points in the casino. It's really like an integrated service management strategy to try to educate consumers. And, this isn't, a gambling specific problem. I mean, this is just consumer marketing. And so all of those different types of strategies need to sort of build up to this overall model where you're actually focusing on this outcome. But it's not obvious that I can point to any one thing and say this is critically important.
And do you accept that the gambling operator has a responsibility to educate EGM users about the risks of gambling on EGMs and to dispel those false beliefs?
So I don't know if you're asking that as sort of a legal question or if you're asking that as like a business ethics question. I feel capable of answering it as the latter.
Well, please do.
And yeah, I think that's true. I think, whenever you sell a product, whether it's gambling or something else, that you want to make sure that the consumer actually knows what they're buying, and that you're not deceptive in those practices.
Thank you. In respect of that gambling advisor you spoke of, has there been any study which has analysed the effectiveness of those advisors in British Columbia?
There is, I don't know that there's been a published study, but there is work, and it's something that we track on an ongoing basis.
And what is your understanding of the effectiveness of those gaming floor advisors?
My understanding is that it's certainly something that is appreciated by consumers, particularly in properties where there is a large local population that attend the casino and where the advisors can build relationships with consumers over time. Certainly there's a lot of, this would be testimonial evidence that at critical points in time when consumers actually need help, that is the individual that they sought out or that staff sought out in order to support individuals during those distressing times.
Thank you. Professor Rockloff, in respect of your strategies, you spoke in your report about the effect of multi-line betting and EGMs, but you did not suggest that the abolition of multi-line betting was an appropriate strategy, harm minimisation strategy. Is there any reason for that?
Well, I think that is a feature of choice. How many lines that you bet on is part of the fun. So I think you probably reduce player enjoyment quite a bit if you only allowed them to push one button, which is how much they bet. That's pretty boring. So this really gets back to that issue of apparent choice, and it's not entirely apparent choice, because as you choose different levels of lines that you bet, you change the volatility, as I explained in the report, it changes the volatility of the machine. So as you choose more lines, the volatility of your wins and losses goes down. That means that you're more likely to win more often, but the wins that you have will be smaller because your bets are spread across all the lines that you're betting on. As you choose one or fewer lines, you'll win less often, but when you win big. And so that is a feature that people find enjoyable. And if you reduced it, I have this sort of thing that I tell people often, and I'll tell you as well, that there's a perfect way to solve the problem of people gambling too much on poker machines, and that's to smear excrement all over the machine, because then nobody will want to play it. Right? So if you make the machine, it's easy to make a machine unattractive and not fun, and people won't play it. The trick is to make a machine that is entertaining, that creates consumer surplus because it's an entertaining experience, and at the same time that has built-in safety features, that has seat belts, as we call it in the report, that prevents people from the worst forms of harm that exist. The other point, which I also make in the report, is that the risk that you have, including the risk of losses, is not a bug, it's a feature. It is what makes the games fun. If you don't have that, I mean, I guess technically, I suppose if you had a game that only won, that would be fun too, but it's not very realistic in terms of an economic model. But in fact, even that anticipation of, is this going to be a winning outcome or is it not, is part of the enjoyment of the process. And so having those multiple lines is a standard feature across these games. And something that allows people to change the nature of the machine in a way that allows them to have greater enjoyment.
Probably should tell you that Western Australia's only had multi-line betting fairly recently. But,
that's so sad.
and the other thing that I wanted to ask you about was game speed and whether a reduction in the speed of game is a harm minimisation issue.
Yeah, so anything that causes you to spend less on the machines, that makes the machines, in essence, less expensive to play, will reduce people's harms because there's less extraction. So it's all about money extraction. One of the problems with poker machines is they're extraordinarily expensive, in Australia in particular. So you can, if you play at maximum intensity on the typical machine, that may or may not be machines in Western Australia, but in New South Wales, for instance, you can lose about $1,200 an hour, and that's the expected loss. You could actually lose more if you're unlucky. And of course, you can lose less or even make money if you're lucky. So try and think of another entertainment opportunity that has that same cost to play. So anything that reduces that, including slowing the machine's speed, will reduce people's harms. There is a point, and again, this is sort of like smearing excrement on machines. There's a point at which the speed of play is so low that you start taking away sort of the fun of the experience, and it no longer becomes an engaging game and a fun game to play. And so, there's a happy medium that has to be created where you have the games that are fast enough so that they're fun, but not, but slow enough that they reduce the rate of extraction. And again, I think as mentioned in the report, you can look at bet speed and bet size as parameters that will change the rate of extraction on the machines, but a better way to look at it is theoretical loss per hour of play, either at typical intensity, which would usually be maximum number of lines paid with the minimum number of bets, or at maximum intensity, which is the maximum number of lines paid at the maximum bet, and see what the typical loss or theoretical loss is over a fixed period of time, and optimize that criteria, because that criteria is actually how much the games cost to play. That's the thing that you want to reduce. changing the speed is just a way of reducing that cost of play over that hour. So why not look at that actual theoretical loss, which is typically not done. They do this sort of, Mickey Mouse, look at the speeds or look at the bet size, which will affect those ultimate outcome, but why not just optimize on the ultimate outcome?
Thank you. Yes, Dr. Philander, would you like to comment on those issues of speed of play and multi-line use in terms of harm minimisation, and also make any other comment you'd like?
Yeah, I just have one small comment about speed of play, which is that it's not obvious what the outcome of speed of play changes would be from a conditioning effects and the potential implications for developing gambling problems. And I say that because it's unclear what a specific time reference for an EGM spin would do to salience of the gambler as they're playing the game. And I'll just draw a quick analogy. So one is if you had an instant game where there was no reels and it just instantly revealed an outcome, that's not something that would create any anticipation or any excitement the way I described when I earlier talked about the near miss effect. So in the near miss effect, that salience seems to be important to that experience becoming important in the way that people might develop gambling problems. And so when you look at, okay, what's this relationship between speed of play and actual spending or potential harms, it's not obvious to me that a change from 3 seconds to 5 seconds or 0 seconds to 3 seconds or anything within that general framework or general range is obvious. I think when you have a lottery that's once a week, that's obviously less problematic, but within what's a reasonable range of period of time for an EGM, it's unclear to me what those effects would be.
Thank you. They were my questions.
Dr. Philander, I've just got a couple of two questions which are related in a way, and just so that I understand your position. When Mr. Lee was questioning you, I think you said that, look, in this area there are lots of good ideas, there are a lot of bad ideas, and one of the problems is that it's difficult to tell which is which. And that I think you went on to say that one of the difficulties is that a lot of the research has been focused on problem gambling rather than on responsible gaming. Now, do I take it from that's the question of balance that you've been referring to? Like the more dirigiste you get with a regulatory system to cater for problem gamblers, known problem gamblers, the greater the threat is to the balance with impact on non-problem gamblers, recreational gamers and so on. And that then throws the balance out of kilter. Is that a fair assessment?
So I think there's a few things there that you identified well that are interrelated, but perhaps it's helpful for me to just explain them a little bit more deeply. So one is that I think you're right. A lot of the research that has occurred in gambling has been very focused on problem gamblers. And that's good research, that's important, but to extrapolate some of those ideas to responsible gambling in the way that management practices should occur in order to deal with people at a subclinical level from a responsible gambling management standpoint. It's not obvious to me that all of these things always apply perfectly. And so I do think that there's a lot of opportunity in the field right now to look at specific responsible gambling oriented interventions, not necessarily things focused on people at that more extreme area of the spectrum. But again, with that qualifier that there are plenty of ideas that are being proposed, and there's barriers in both from a regulatory standpoint, but from an operator standpoint for researchers or other people who just have good ideas and want to innovate in this space to be able to test them. It's just, I think that's, a couple of related ideas. Yeah.
Thank you. Dr. Rockloff, is there anything you wanted to add to that?
No, nothing to add.
All right, thank you. Now, Mr. Lee, with
Thank you,
the
Commissioner.
re-examination.
Just a single question for you, Professor Rockloff. And the question I ask is in relation to the topic that we've discussed today of the potential for bias, including unconscious bias as a result of industry funding. And I'll say the same thing to you that I said to Dr. Philander. This is a question that's asked in the abstract. I'm not talking about any particular person, and I don't want us to go into any particular individual when we have this discussion. You were taken to a paper by Mr. Dharmananda, and it was suggested to you that that paper had done an analysis looking to see whether there might be bias, and the conclusion of that study that it was shown suggested that there was no bias identified. Can you just explain to the Commission what your understanding is as to how the provision of industry funding may lead to that unconscious bias? What are the mechanics or the steps that go from taking money to ultimately resulting in influence on the work that an academic is doing?
Yeah, and I find this in my own work, and it's something that you can't completely divorce yourself from. So, I'm often funded by government people, and I like them. They give me money, and obviously when you're hired for doing a report, you want to come out with good results that help them do their job in some way, because that's what they're paying for. And that's and even when you're trying to be, and we do try to be to our best of our ability, as objective as possible, I recognize my own bias in trying to produce results that will make a funder happy, because I anticipate that I'll want future funding from them, and if I do a bad job, then that funding may not be forthcoming. Now, the typical thing that's done with industry funding in Australia and across the world is that there will be elaborate processes put in place to try and separate industry from the funding decisions or even the ideas that are put forward for funding. And so the typical idea is that people will put together a research proposal. It will go to some independent committee, usually comprised of academics, and sometimes, in the case of the UK and Gamble Aware, it will be academics who are not in the gambling field, so they'll be in a related field of addiction or something like that. And then those people would decide whether it's a good idea and worthy of funding, and then they would then make the decisions independent of industry. The industry would just give a bucket of money each year to this organization, and then they would fund worthy projects as decided by independent experts, which on the surface of it seems fine, and I guess it's better than direct industry funding where the industry body says, hey, this is what we want you to investigate. But the problem with it is that it creates the knowledge that if I produce results that consistently poke at industry, that create trouble for industry in terms of the results I'm finding, will, as a profit maximizing entity, will the industry decide, this isn't actually the best use of our funds to create this pile of research that is not conducive to our interests. It also generally attracts, research that is consistent with this notion of gambling as a addictive disorder that affects a small number of people. And I think you generally find that research that's done in that area is research that is not that is valuable, but is narrowly focused on addiction, and often in the case of Gamble Aware in the UK, to make it a little bit distant from our own shores, is often based on things like neuroscience, like trying to understand the neuroscience of addicted gamblers and putting them through fMRI machines and things like that, which is all very interesting and valuable sort of research, but it is focused on a very narrow set of research that actually doesn't trouble industry at all, because it and in fact feeds into a narrative that all we have to do is deal with people who have severe gambling problems by offering them self-exclusion or some other approach, and that everybody else can gamble without any safety or real safety systems involved, at least from my perspective, at all. So I guess that, I don't know if I've rounded about your question, but hopefully that'll be in the range of what you were asking for.
I might just follow up with one final question, and that is, you've identified some problems of industry funding, and you've also identified some problems even of one-step removed funding.
Yeah.
You may not have an answer to this, but is there a model that you would suggest to this commission that may be appropriate for future work as to how there could be funding of research that would not run into any of the problems with which you are concerned?
Yeah, I think that probably the best model, and and it probably will never happen, but here's hoping, is that funding for gambling research would be dedicated and would be national. So each state is both responsible. It has an agency problem in that they're responsible in Australia, responsible for both collecting a huge amount of money from gambling industry. It's about 10% of state budgets. And at the same time, they're responsible for minimizing gambling harm, and yet those two are fundamentally incompatible by degrees. As you ramp up money extraction taken from individual gamblers, you're necessarily going to cause at least some harm, and so there's some incompatibility there. And the best notion would be funding that from like the federal government that actually doesn't get any money from gambling industry, or at least as far as I know, certainly not EGMs, and therefore they would be have a truly national approach that would probably produce the best outcomes in terms of maximizing the needs of gambling consumers, across the country, as opposed to having to deal with that dual agency problem that states have to deal with.
Thank you, Professor.
Professor Rockloff, did you want to make any closing statement, or are you happy with what we have?
I think I'm happy with what we have. Thank you.
All right, thank you. Mr. Dharmananda.
No re-examination, thank you.
Dr. Philander, is there anything you would like to put to us by way of a closing statement?
Nothing more from me. Thank you.
All right, thank you. Well, that brings to a close the concurrent evidence session. Dr. Philander, Professor Rockloff, you have our gratitude both for your written reports and your oral presentations. It has been most illuminating, and we also acknowledge the respectful way in which you have dealt with the process, which has allowed it, I think, has increased its effectiveness from our perspective. So thank you very much indeed. Now, Dr. Philander, I think we can let you go. It's getting late where you are. Thank you very much. Professor Rockloff, we're not quite in the same position with you. But can we get an indication, a rough indication of time, do you think, Mr. Dharmananda?
I imagine I have probably about 45 minutes to an hour of cross-examination left.
All right, well, that makes the decision fairly easy then. What's that say?
123.
123.
2 o'clock, 2 p.m. Professor Rockloff, I think we'll break till 2 p.m, which will be 4 p.m. your time.
Oh,
No, it's Queensland.
Queensland.
Yeah. So we'll come back at 2 p.m.